what is said so you understand the current status of COVID. Thank you very much. 1.4, receive an update regarding the coronavirus COVID-19 and Trinity County.
Thank you, Madam Chair, members of the board, public. I'll go ahead and start, and I'm going to ask Liz to do a PowerPoint with a presentation of the different phases that we're going through and we're going to be moving into, and then we'll have Marcy come up and do the medical portion of this. But we've been in close contact with the state. Our employees and our staff have been working with the state through this whole phase 1 that we're in right now. Our stay-at-home order, which has been, we understand, very difficult for the public and for those that are not able to venture out to work and participate in what our community has to offer. However, it's been a recommendation of staff the entire time not to violate the governor's orders. And the reason being is, as I said, we've been in contact with the state through this whole pandemic and have been confident that we would be able to reopen through the governor's orders around mid-May. And it looks like our predictions were correct, because from yesterday's press conference, we are going to open up on May 8th, which is this Friday. In order to do so, we had to be prepared with a plan which would allow us to mitigate the risk factors to our public, and also essentially have a contract with the state on how we would monitor our phase-in. Because we are at 0 cases here, and we're in a smaller region, we can participate in what's called the accelerated reopening. So we'll be able to offer more services and more, lack of a better word, freedoms to our residents. I do want to remind the public, because I have heard through many of the emails that we are violating constitutional rights, but I do want to remind them that we are not only, when we hold our hand to the Bible to swear to defend the Constitution, we also swear not only the federal Constitution, but also the state Constitution, which has our health and safety rights in it. So we are bound by the state and a subsidiary of the state to follow we are bound to follow these. Now, the board has the authority to violate orders, but the recommendation from the staff from the very beginning is to please follow the governor's orders, because we were confident that we would be moving forward by mid-May. With that being said, some of the issues that would have happened if we did violate the orders is funding, not only for the county proper, but the entire county, the residents, could be reduced or eliminated. We felt that was a risk that wasn't worth taking, meaning that there's funding out there that's going to be available for the next 6 to 8 months for small businesses. Had we chosen to violate the governor's orders, those could have been rescinded. So there could have been severe consequences. If a county that has violated the governor's orders has a surge in cases, they may have a slower response by the state and could be personally liable for those cases. So we just felt it was prudent to hold the line and follow the governor's orders. And I feel we made the correct decision, and we appreciate the board supporting the staff in doing so, because we will be opening up on the 8th with an accelerated plan. So at that time, I'd really like to bring Marcy up, and she can explain the different phases. Is that Margaret?
Margaret?
Yes.
Either you're not on mute and you're addressing something else, or perhaps you wanted to weigh in. I'm sorry.
That was not me.
Okay, sorry about that.
So I'd like to ask our interim director of Health and Human Services to present the phases that the phase we're in, the phase we're moving into, how we move from one to the phase, and also a PowerPoint presentation for local businesses to assist them to get certified as COVID compliant and move to reopening as quick as possible.
Good morning, Liz Hamilton, Interim Director of Health and Human Services and Office of Emergency Services. As Dr. Coons has kind of queued up for me, we have established a plan, and this is in coordination with, of course, Public Health as our incident command during this pandemic for our local community, environmental health, Sheriff's Department, Office of Emergency Services, and of course, County Administration.
We're having a technical difficulty. We're going to put the speaker, we're going to bring your podium a little closer and put the speaker closer to you. You're standing in the back and they might listen to him more than me.
There you go.
Yeah, I hope. Maybe they're not. Okay, please continue, Ms. Hamilton.
Okay.
Pound 6.
Okay. Consistent with the governor and the state orders and state health orders, we have identified for Trinity County 4 phases that mirrors. We are currently, as you're aware, in phase 1, where there is monitoring, surveillance, local evaluation. This is a heavy lift. This is not something that I want anyone to underestimate the workload that has gone into phase 1 and the planning and all that is associated with public health, environmental health. To move from phase 1 to phase 2, we're doing so with the governor's order to do so, which he has introduced yesterday, statewide, moving to this phase 2 at a modified or reduced level. He's wanting to see phase 2 roll out incrementally, of course, because as more foot traffic, more business traffic happens, we are at risk of exposure, and we want to make sure that we're doing that thoughtfully and carefully for the health and well-being of all. The state has, Governor Newsom yesterday stated that phase 2, as early as this Friday, could include retail businesses opening in a curbside delivery and manner. This is very narrow and limited. Some of the other pieces are opening up trails, allowing car dealerships to reopen in limited capacity, of course. A lot of the things that the state is allowing, we had not necessarily restricted to the full capacity here. And so I want people to understand that for recreation and trailheads, those have remained open, whereas in other counties they had not. And so moving into phase 2, the governor has allowed an accelerated rate for counties that have had either no or low exposure. And in the North State, we really see how regionally we are faring much better than our southern part of the state. For us in phase 2, we are talking about low-risk businesses, and I'm on page 4, being able to assess how they can open safely with safety guidelines in place that will be reviewed by environmental health. Businesses such as manufacturers, retail stores, and small offices where telework is not available may reopen. We are asking that businesses that are currently able to operate with limited and or closed lobbies continue to do so. Businesses should encourage telework whenever possible and feasible for business operations. Return to work should be phased, provided appropriate physical distancing and ensuring that sick employees do not come to work. We want to provide and continue to provide as many services as feasible with limited contact. So online orders with store pickup, limiting numbers of clients in a lobby or waiting area, and staggering appointments. Phase 3, which will be again at the governor's direction, will include the higher risk work environments that they have categorized as personal care, entertainment venues, sporting events without a live audience, and in-person religious services, including weddings. Stage 4, or phase 4, would be at the point in time where the governor releases the stay-at-home orders entirely and business returns as usual. I cannot tell you the estimate of when we think the governor will go to phase 3 or phase 4. Where we are at right now, which is exciting, is the ability to move into phase 2. For most of the state, that's going to be very limited. And then for counties such as ours, we can move to an accelerated pace, which Marcy will get into some more of that in her report out. what we are asking for businesses that are considered the low-risk businesses, as I've described, retail, which could include shoe stores, small business, small office, those type of stores. We're asking that they visit trinitycounty.org, and we're going to go through on the main page. Businesses will be able to, this is not up and live, this is just a sneak preview that will be released this week. But for the board to be able to see, for a business, they will be able to click on a link from their main web page. They will register their business information. We are wanting to prepare and send guidance from the state to every business sector that's appropriate. They will load their information here, submit next page, and then it's going to walk them through guidance and protocol on what they should be considering and thinking of before they open their business. So we're going to quickly go through this, but of course the primary issues are going to be signage, how they're going to protect their staff, which includes monitoring break rooms, cleaning routines, helping to send staff home that are ill, clicking through to the next. Their measures, each business's measures to ensure physical distancing, not only for their staff, but for the public that they engage with. Measures to prevent unnecessary contact. Measures to increase sanitation. And then there'll be an electronic signature. When a business has gone through and they are able to review the things that are being asked at a statewide level for Cal OSHA and best business practices, they'll receive their submission, they'll receive a copy of this via email so that they know and can recall what they agreed to. And then this will go to environmental health where it will be reviewed. Upon review, they'll receive a compliance certificate that they can hang in their business window so that the public can be assured as a consumer of their goods that they are compliant with the county and following the standards. We hope for one that provides the security that businesses need to draw customers. We want to see success in phased reopening. We want patrons to feel confident in going out and spending money and engaging in the community carefully, safely, and in a socially distant manner. So we hope that provides assurances for the public and for business. Ms. Anderson with Environmental Health will provide as much information that is needed per each business sector to safely reopen in their parameters. Yes.
Which phase is the resorts into? We don't specifically call that out, but
Liz, could you please repeat the question for the people on live stream as well as on the phone? And Dero may want a picture of your compliance so people will know what it looks like.
Thank you. So the question from Supervisor Groves is about resorts and are they specified in here? And resorts remains a topic of discussion at a statewide because why, as a small business, they would be able to potentially reopen with the safety parameters in place for in-county visitors. The state has not given further direction on inter-county travel throughout the state. And so we are waiting for further direction on that.
But under the county phase-in plan, they could go online and complete the project, and we would certify them as COVID safe. So we are not enforcing the state ban on travel. So what we would be doing is ensuring that their operations are safe. If people around the state choose to violate the state order, there's nothing we can do about that, except make sure when they're in the county that they're at a safe business that is willing to remedy. So it's kind of a catch-22. So my answer, and I'm gonna go on a limb, my answer is yes, they can open. But would their operations would not violate any state order. Actually the patrons of their operation would. So it would be it would be up to the citizens to decide whether they want to participate in non-essential travel.
Thank you.
Does Supervisor Finley, do you have any questions? Supervisor Morris has a question, then I have a follow-up.
So does that apply to hotels and motels?
They specifically, I thought motels and
I
hotels
think
could
Christie
open, but
wants
it's
to
still a
add
travel
something.
issue.
Ms. Anderson?
So, Christy Anderson, Environmental Health. I think if I'm correct in addressing this, it would currently remove our county travel ban and replace it. So that would make hotels, motels able to accept guests that are non-essential.
And with them being open, they, of course, that hotel, place of business would have to follow the protective safety guidelines to keep our residents safe and their guests safe.
Correct.
And this will help them lay out guidelines to do that, I'm hoping.
Yes,
Okay.
very detailed.
Okay. And then in terms of, in yesterday's announcement, there were 2 phases of phase 2. My understanding, and CSAC has been working very hard on trying to get regional acceptance from the governor as well as small counties, as CAO Coons described the situation we're in. So we could kind of move the second phase 2 up, is my understanding, because of our situation. And so is there anything we should know about that? I mean, for instance, it calls out retail, curbside only. I don't see a reason, if there's distancing going on in phase 2 for retailers, that they couldn't open completely. I'm gonna use the bookstore, for instance, or the gallery in my district. As long as that business owner kept this safe distancing and protocols and let's face it, unless it's a huge day of business, 4th of July weekend, Thanksgiving, they're not going to get a ton of people in their business at one time. I would hate to limit them at this point to curbside. And they would have to police, monitor the folks in their business. So am I understanding that correctly? There's some wiggle room to do that with?
Is that within the accelerated phase?
It's within the accelerated phase. So you're correct in that yes, your comments are correct. There are 2 phases that the governor described yesterday within phase 2. One that applies to all, and then for counties with jurisdictions that can apply and request for an accelerated pace of unfolding, which Marcy will describe the phases from a public health perspective. I realize right now we're focusing on the business side of moving an accelerated phase 2 forward. However, there's a public health component. Of course, we want to do this safely, and so I want to give Marcy a chance to unfold some of that, and that might answer additional questions the board might have.
Absolutely, and I appreciate both paths we have to take into consideration. All right, I will hold more questions till Marcy gets
Okay,
up.
so Liz, real quick, could you reiterate on the reopening of Trinity County on the draft that you presented to the board, when that'll be available online, as well as when the COVID-19 business plan, when you expect it? And before you do that, I just want to thank you from the board. We realize that a lot of times people get baptism by fire up here. Yours was fire under COVID. We had a wonderful director, and as she exited, this was in its infant state, and we realize the work that the whole team has done, but we know you are also taking a brand new hat, per se. So we thank you. You've really stepped up to the plate, and we appreciate. We know this baptism by COVID was difficult. Thank you very much.
Thank you, Madam Chair. I appreciate that. Our team has worked seamlessly, a countywide team, and you know, I am from here, I'm invested in this community, I know what it means to our small businesses to be able to reopen. This doesn't fall lightly on our collective team. We want to manage this safely and consistently with the state and federal governments. And so I appreciate the support that Dr. Coons has offered our team and the support of the board. I understand the frustrations on either side. I understand why businesses want to reopen. I understand why a large percent of our demographic here is potentially terrified of reopening and folks coming into town. And so it's a balancing act on both parts, and we want to do the best that we can for all people. We allow freedoms, you know, to return because we want those freedoms to return. But we have to be able to monitor the health and well-being of our community at the same time, which I know that we all want to do. And so to work efficiently and quickly as the state is allowing us, I'm delighted that we have an opportunity to participate in an accelerated phase reopening, and we hope that that continues, the phases continue to unfold safely, you know, that we don't just stay at phase 2, and definitely that we move quickly as well. So with that,
And the expectation of...
oh, I'm sorry, yes, the expectation of this is once, you know, we wanted to gather input from the Board of Supervisors, have a chance to hear public comment, and then when our health officer approves this, it will be posted.
Thank you. Public, everybody on the phone, please mute your phone. And Kelly, I know you said that you were the only one with an open cell, but somebody out there has a cell on, and we can hear honking and conversation. It makes it very difficult to govern. Please mute your phone. Good morning, Marcy. Welcome.
Thank you, Madam Chair. Thank you all so much for the opportunity to update you on the COVID response in Trinity County. As things are changing very quickly, unfortunately I haven't committed this to memory, so I'm going to be referring to my notes quite a bit. As you know, we've tested 93 individuals in Trinity County, and of those, there have been no positives identified, and there are no pending tests. It's important to note that 93 tests from the beginning of March till now represent 1 to 2 to a maximum of 3 persons per day being tested, and that is insufficient for us to be able to surveil the activity moving forward. And I'll go through some of our plans to address that. So as you know, the California Department of Public Health has expanded the testing guidance prioritization. This was released Friday, May 1st. So Tier 1 now includes not only hospitalized patients, but also symptomatic and asymptomatic healthcare workers, first responders, including law enforcement, public health, and social service employees. This tier also includes now symptomatic and asymptomatic persons over the age of 65 years, or any persons with chronic health conditions that put them at risk for severe illness due to COVID-19. Also, persons identified for testing by public health contact investigations and disease control activities in high-risk settings are also included in the Tier 1 testing priority. Screening of asymptomatic residents or employees of congregate living facilities, such as skilled nursing facilities, including after positive cases have been identified in facilities or prior to residents' admission or readmission to a facility. Symptomatic and asymptomatic persons in essential occupations. This includes utility workers, grocery store workers, and other public employees. And also in Tier 1, they've included other lower risk symptomatic persons. Tier 2 includes all lower risk asymptomatic persons, and Tier 3 includes community surveillance of asymptomatic persons as part of the community or regional surveillance program. As our OES Director, Liz Hamilton, and our CAO, Dr. Richard Kuntz, stated, the modifications this week allow some retail entities to open with curbside delivery, as well as the manufacturing sectors that support those entities. Governor Newsom has also laid out a path for particular geographic regions, including rural counties that either have no positive cases or few cases, to accelerate some modifications within phase 2 beyond those retail stores he identified. For example, implementing safe restaurant, dining in while maintaining appropriate social distancing. In order for this to occur, the local health officer in each jurisdiction must attest that the county has the ability to mitigate and contain any subsequent outbreaks through the following: increased testing capacity. Initially, the threshold required is to test 1 to 2 persons for every 1,000 persons in our population. For Trinity County, that means right now, immediately, we increase our capacity to test 13 persons per day, eventually very quickly moving to 26 persons tested per day. We have to have the ability to collect and monitor data. This includes testing data, hospital and regional data around surge capacity, and the ability to surge up to 25% of our normal inpatient capacity. It also includes monitoring of occupational exposure data and a framework to expand contact tracing workforce based on an assumption that for every positive case there may be up to 10 contacts. This is a heavy lift. Health departments are, as you've heard Governor Newsom say, we're very good at contact tracing. It's foundational to what we do and what we're funded to do. The ability to test and quarantine vulnerable populations, and currently we're collaborating with California Department of Public Health and local partners to increase availability of testing and include private partnerships formed with the state to help us in expanding testing. Contact tracing goes hand in hand with that. I look at it like a testing, contact tracing, testing sandwich, so to speak, because you test to see what it looks like in the community. You expand testing to try to broaden your reach as you open things up to ensure we're not going to have outbreaks. And then you're going to contact trace those persons. If you have a positive case, you have to contact every person and monitor them for symptoms. All those things that are in place for that, and we can go into more detail if you wish. And then as a result of that, you're going to have more testing to test the contacts to ensure that they're not positive. And so that's kind of where we're at. We do have contact. I'm sure you've heard Governor Newsom talk about the army of contact tracers, the workforce that he's building up at the state level. He's worked in partnership with UCSF and UCLA to implement a training program for contact tracers. This is a 20-hour program with 12 hours of instruction online, and then he stated 8 hours in person. My guess is that's virtual, one-on-one. And so we're looking at accessing all of these resources to be able to respond to our public's needs as we begin to modify the stay-at-home orders in Trinity County. And I'm happy to answer any questions you might have.
Supervisor Rose.
So when you refer to testing, you're referring to just yes or no, not the
Serology.
yes.
Yeah. Yes. The PCR molecular testing, that's the qualitative test that tells you whether in that moment you're positive or you're negative. The serology testing is very important for public health surveillance, and we're looking forward to that becoming available. We're ways off with that related to the test itself and capacity. The serology testing is really helpful because it tells us whether a person has antibodies. And there are windows of when that has to happen and then what it means. So Stanford University is conducting a study right now using ICU staff persons as a cohort to look at, we need to determine, okay, not just if they have IgG antibodies. IgG is what shows you the antibodies when an illness is passed. And there's a point in time that has to occur. So it takes about 2 to 3 weeks for those antibodies to mount. And so what they're looking at, number one, is what does that look like, and is it unique to COVID-19? But also, how do we determine what's protective? In other words, if they have these antibodies, what threshold becomes protective? So there's still some things that are unknown, but there's a lot of research that's catching up, and I'm very hopeful that that will happen very soon. And so we talk about testing in Trinity County, it's the collection, it's the ability to collect the specimen, because we don't have a high-level capacity in Trinity County to run tests.
So I want to follow up. I run into a reasonable amount of people that feel that they've had this already, that in December and January, they were very sick, and so they're not worried because they've already had it. How do we get them tested to see if they did have it? Because my fear is that they're going to be overconfident that they've already fought this off and it was some other flu that they had.
Right, and the challenge, Supervisor Groves, is that we don't have a clear answer to that right now. What we do know, however, is the health department, in consultation with the state and Dr. Coons and our OES, we are ensuring that we have the capacity that if we have outbreaks, for whatever reason, that we can respond appropriately. That's in the now. We have the ability to test in the now if people are positive or negative. I anticipate at some point in the future, the capacity to do serology testing and identify those that are immune is going to be really important in that particular scenario you just laid out. The other element that's very important is the vaccine. So as we stated in our press conference last Friday, health experts state this virus is going to be around until one of two things happens. It either infects 70% of the population, they become immune through infection, or they become immune through vaccination. That is what drives the public health system here to do what we need to do to try to prevent that from happening. And so, point well taken, and we're really hoping that the research bears out the serology test and makes it more widely available. Part of the problem right now is because it's a statewide pandemic and a national pandemic, a lot of the resources are being taken up by counties that have large community spread and ongoing outbreaks that are continuing. So we're trying to work with our state, we are working with our state partners to ensure that Trinity County, our little county, gets our needs met as much as other large counties that have outbreaks. Even though we do not have outbreaks based on our testing, we still have needs that need to be met, and we're going to make sure that that happens.
John? Oh, Mrs. Supervisor Fisk?
It was answered.
Okay, Supervisor Morris?
So it sounds like the 4 points, surge capacity, PPEs, testing, what else did I miss? Tracing, contacting. We're kind of in good shape is where we're at, if I heard you correctly.
Yes, I'm not going to be overly optimistic because I'm still relying on partners. We have a meeting this week with our clinic partners. A lot of our testing capacity will rely on our clinics at this moment in time. One of the issues we just resolved working with the state was that in the clinical setting, most of the testing done for diagnostic purposes has to fall under a certain CPT or code so that they can bill insurance. With COVID-19, they've changed those rules so providers can bill for testing of asymptomatic persons just for the just because it's a pandemic. So they will get reimbursed through insurances to do that. So there's a lot of nuances we're working out to stand up our capacity utilizing our clinical partners. Our hospital lab does have an analyzer, and they have some test kits that they can do testing on, but it became clear from the state that we will not likely get any more test kits like that from Abbott that provide us rapid results in our hospital lab. It's just not going to happen due to capacity and other needs. So we've talked with the lab and asked them to prioritize those tests for someone that they may need to know right now. If it's a hospitalized person and they're really concerned that they are positive and they may have infected healthcare workers, that'd be a great example of what that test would be reserved for. So there's only 20, excuse me, I think they have 22 left, so.
With the new testing centers on each side of us, Shasta and Humboldt, that will come into play and help us as well as we move forward?
Yes, Supervisor Morris, thank you very much for that. So what we're doing is we're really putting together an innovative strategy that's unique for our county. So on the one hand, the people that have the means and the ability to access the Optum testing site in Reading, we're going to ensure they have the information they need to do so. The phone number to make the appointments. The turnaround time for appointments seems fairly quick. At this point in time, we don't see any problems with that. We'll see what happens as we go down the road. It's fairly straightforward. Those testing sites collect the specimen. They do not run the tests. They have the ability to collect many specimens. They can do 132 specimens a day and then transport them to labs. Making sure that there's lab capacity to run those tests in working with state partners and local regional partners. And so in that capacity, we're looking at our firefighters. We're working with our forestry to get firefighters there to be tested that are coming into the county. We're also looking at, for example, through one of our CMSP grants, we're looking at equity in testing. So those community persons that may have limited resources, for example, the grant will purchase gas vouchers to ensure that people have the ability to get to testing. Our clinic partners will be huge in that effort as well. And so looking at, okay, so what's the strategy for testing our inmates? That's something that we know needs to happen. We're not sure how we're going to do that yet, but we're going to be working with our jail commander to see how in fact we can do that. Because what we need to do is really make sure that we're testing high-risk individuals in congregate settings. Because those inmates are high-risk individuals in congregate settings. And we want to make sure we understand their clinical picture around COVID-19 to protect both the inmates and our staff in the jail.
We're getting a little bit of feedback, and I don't know if it's from the speaker or that or from open phones. Another reminder to put your phones on mute. All those that are waiting to speak on public comment, you will be called on. Thank you. Mute your phone. It might be the loop, but Supervisor Brown also had a question.
I just wanted to ask if you're confident that our state resource support is sufficient enough for our current position in time.
I don't have a clear answer for that yet. I can tell you that they've been very responsive when we've elevated our concerns up the chain to our legislator and our assembly member. We've been in contact with the testing task force directly, and we were given, this was yesterday, and we were given a lot of information and insights that can help us. And so the problem, Supervisor Brown, is the fact what's available based on the landscape in California around this disease. A lot of those resources are being taken up around testing for the contact tracing on a grand scale that's going on in other communities, in the Bay Area. So the longer we can kind of mitigate, this is all about mitigating and containing as we open up our businesses moving forward. Trying to still buy us enough time to be able to put those things in place if we need to respond on a grander scale. And we are working with, we do have their ear, and I anticipate that we will get the help we need. Yeah.
So Marcy, I don't know if this is for you or Ed, if you're on the phone, and maybe not a brief today, but a question going forward. One of the concerns is the PPE, the personal protective equipment for our firefighters. And if at a later point you could bring the status back, I know that the federal government is making a push to provide those, but it'd be nice to know. We've had a lot of volunteerism and social media providing specifically the mask for the firefighters throughout the county. So at some point, it'd be nice to know what we have and where it is for our firefighters.
Absolutely, thank you, Chair Chadwick, I appreciate that. We are, the supply chain for PPE has begun to open up considerably. We're working with our first responders, TCLS, and a variety of other partners to ensure all those in essential services have sufficient PPE. And so we continue to do that. And I don't know if Ed has anything he wants to add to that.
We're still struggling
Yeah.
incredibly. I keep getting texts from the department heads that
They
the
can't.
feedback from people that don't have their phones muted.
Can you
It's
shut
just,
it off and let them call back?
I would have to.
Yeah.
But it's,
Well, let's finish with Marcy, and then if you can text Ed, that's a future thing. I don't need it today, I'm just putting it on your radar, and I
Sure.
appreciate it. And so I think if we can go ahead and conclude with this.
yeah, what we'd like to do is bring Liz up, and what she can do is just kind of summarize of how
Liz
we're
or
gonna-
Chris, okay, Liz,
Yeah,
yes.
and we kind of summarize the opening process, because we're hoping to be open within the next few days, so.
And I still have
your
more
questions.
specific questions I was gonna wait for, so.
Maybe Liz will answer
Okay.
before we ask.
Or we can just open up the questions to all three of us, and maybe that'll answer them.
Well, does Liz have more information to offer to us before I jump?
Do we more, like, summarize what the plan is, how we can get the certifications out to the public, things like that?
I mean, I can just roll through a ton of questions
Okay.
that I have.
No, that's
Yeah.
it, and we're here as long as you need us.
If that's okay, Chair.
Well, Dylan, I know you have a presentation, are you good?
Yeah, we're all, no rush here.
Okay, thank you so much. Those people on the phone, we're going to have to turn you off and have you redial in if you do not mute. We have department heads and staff that cannot hear because of all the feedback. Thank you.
Thank you.
Go ahead, Liz.
Yeah, thank you. Once again, thank you for letting us present to the board. In summary, we are positioned to move to phase 2 of the accelerated version that the state has provided. We will have documents posted on our TrininityCounty.org website and a place for businesses to go on and start registering and seeing what they need to do to safely open up with a stamp of approval from our health department and environmental health. Christy Anderson can add to that how she wants, but she's been very busy, very engaged with community and business and helping for the existing businesses that are open to help keep them safe and patrons safe, and we'll continue to do that work as we unfold this more. I don't have a date on when this will be released, but we will, through Office of Emergency Service, we will put out a press release once we know that our website and all the forms are correct and approved.
So I'm sorry.
Hold on a second. Did you want to add to that before we start taking questions?
Well, just in anticipation of the question, the stores being able to allow customers into the store. Again, as we said, that will be the accelerated and on a case-by-case basis, so that will be part of the website. They do a risk mitigation, and then we'll be able to, we'll have the authority at the local level, not have to go to the state, but local level to make the determination. Is that correct?
Correct.
Okay.
So Supervisor Morris and then Supervisor Groves.
Thank you. So our local level, according to that portal, if you will determine if a store can open. Did I hear that wrong?
Yes, because there'll be some businesses that will be not in phase 2, they'll be in a phase 3, it'll be actually listed, where at our level, because of the size of our community, because of some of the constraints we can put on and mitigate, I believe we'll be able to open. Now, I don't want to say for certain, go ahead and discuss one that we've discussed in the past. I'll say the gym. In other areas, that is in phase 3, there's no question, there's no way, because most gyms have 100 to 200 people in at a time.
Right.
Ours would be able to mitigate down to 10.
Right.
So that's something we could consider in our phase 2. We have to
Gotcha.
negotiate with the state a little bit, but we can mitigate the health risks at our gym because the amount of people that we can allow in at a time. Where a gym, say in Reading, where there's 75 people every day at 5 o'clock, there's just no way they can keep it below 10. So that's one of the type of things that we hopefully will have the flexibility in our area to open up more than other areas to be able to open.
Okay, so it is to their benefit to, once this is released, to jump into that portal, start putting in their information. They can make the case, yeah, we can stay within these parameters and stay safe, offer our customer safety, and open, if I hear you correctly.
Correct.
That goes for all businesses, obviously.
We encourage them to do it immediately.
And so, currently, we have restaurants that are just takeout. If I read or remember correctly, phase 2 allows for some in dining with provisions. Is that accounted for in this portal to, I'm a restaurant owner?
Correct. Phase 2 at the state level, they had discussed, several times reducing dining to half capacity, having tables spaced, so where you come in a cohort, you stay together, servers wearing face coverings, etc. I mean, the list goes on. When you come into food and service industry, there's a lot more on the checklist with sanitation and the way that you engage your public. And so those are outlined on our website. They'll take you through if you are a food and beverage industry. Again, the guidelines and best business practices are listed.
Okay, and then, so stores, they could likely just open and have a limited amount of people that actually come in and do curbside as well if they choose to for their customers who may feel more comfortable doing curbside at the moment.
Correct. It would continue to be recommended for businesses that can sell their product online or do curbside. That would be the preference. Limiting the store patrons is an option in phase 2.
Yeah, I think the smaller businesses in my district, they're not going to get the volume they need in terms of online. Bigger stores that have been open certainly have put forth some safety practices. Some have done it better than others. I've received a lot of complaints. Certain essential businesses certainly weren't putting together the safety protocols. And so when you scale down to, I'm going to say micro businesses, which many of our really small businesses are, that are the mom and pops on our streets in any part of the county, they're not set up to pivot into an online situation and get the business they need. They are going to need some walk-in, as well as curbside, if that works for them as well. And then, is there room on this portal if a certain industry sector, whether it's the restaurant or just regular retail, to offer suggestions, hey, we can do something a little different that would meet your guidelines, but we feel we could do this better in this scenario? Is there a way for feedback for them to offer that?
That is an excellent suggestion that I'm hearing. I think the best way to navigate those case-by-case scenarios is for those businesses to work with environmental health directly. I think that's a great partnership that should be there. I think there's some room for innovation and creative ideas on a case-by-case basis.
And I'm wrapping up, Chair. So in theory, we're looking at most retail to be able to open by Friday. I'm kind of making sure I'm hearing everyone correctly. There is certainly an opportunity for the gym to open, given our situation to some degree. Likely, they've got to jump through the portal, if you will. And then the other retail, I don't know if has been considered. I understand salons are in phase 3.
Correct.
A lot of our salons also are retail. They just don't do haircuts. So has there been consideration about those? For someone to just walk in, they have favorite shampoo they buy from their salon person. Can they go buy that still and not get their hair cut? Or when can they get their hair cut?
I agree that there is some flexibility for those salons that do have product that could be sold. That's a great example of where a curbside delivery could work wonderfully. Now, the reason why a lot of the personal care is moved into phase 3 that the governor has laid out is because you cannot maintain that 6 feet. And we really want to have those strategies in place and know that we have good community surveillance before we're encouraging business that is in that close contact to be up and going.
I would ask all of you, as you take this plan to the state, to, again, using the same logic we're kind of using on the gym, our salons, at least in my district, don't have 20 people in their salon, or our barber. You guys can tell me better what the barber chair is like, but they, you know, a lot of them have one person, one chair that someone can come in. They can limit people coming in just to browse. If they have more than one chair, they can stagger those appointments. I think there's a way to make a case to the state to kind of accelerate that a little bit. I would put that on your radar and notes.
Yeah, that's one we're really struggling with, because with salons, it's not the number of patrons in the business, it is the close proximity, where if someone's getting their hair done, it takes 45 minutes and they're within, you know, a foot of that person for 45 minutes. That's what we have to figure out how to mitigate that. I think Marcy is going to come up and
So let's hear from a health expert on the reasons why.
And just, Supervisor Morris, absolutely. There's a million what ifs. We know that. And what we try to frame it as is if you think the issue with the care, the barber, the cosmetologist, they are in close proximity, they're within 6 feet of someone for longer than 15 minutes, okay? So the key is, within 6 feet, longer than 15 minutes is sufficient time to transmit from asymptomatic persons. So they won't know that the barber could have it, the cosmetologist could have it. Same with nail salons, you're within 6 feet. So they could have it, and they can transmit it. Then this person goes in the community, and remember, for every one person that's positive, they can spread it exponentially, and you will have, from one contact, you can have a cohort outbreak. They go back to their communities. And what's key here is really ensuring, fundamentally, the protections for those at greatest risk, okay? Who, you know, grandmothers, we have older populations caring for children. So we're going to have, and I'm not a fatalist in any way, but this is the real concern. So that is why we want to be really clear about the importance of that 6-foot distance when we start to incrementally phase open the county businesses.
And I appreciate that, and I'm glad you mentioned that 15-minute. I had not heard that 15-minute piece before, and so I understand that close proximity in those type of businesses and the need to, you know, I mean, at least some of them might be able to get moving, at least on the retail level, the curbside stuff. So I just wanted, since we don't have these conversations often on a daily basis with you, I just wanted to make sure we're throwing these ideas out. You guys are doing a great job. Your plates are full. But I just want to make sure what I see going on, at least in my district, and the needs.
Move it along. I know Mr. Supervisor Groves, and I have some things, but thank you.
Well, let me just state one last thing. Yesterday is when we found out that guidance about the 15 minutes.
Right.
So I want to make sure when we know it, we're going to let our board know and our population know. Thank you.
Thank you. Supervisor Groves.
So, I'm kind of more interested in the logistics. You have a store, Supervisor Morris mentioned that they could be up and running by Friday, but logistically, if they go on this website, which we don't have up yet, and Christie's an army of one, how do we, you know, you're going to get 500 plans. How do we go through and deal with those plans and still do this in somewhat of a expedient fashion?
Christy, you want to come up to this? Thank you.
Hello. So we have considered this, and the website will really give the quick answers for them to, if you notice, it's yes, 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 but if they don't have those in place, it's going to be incomplete submittal. Those complete submittals should address all the safety concerns, and we're going to get a little more in detail today, so that it's not review this plan thoroughly. It's all the boxes have been checked. Let's issue them a certificate of compliance, and then from there, if there's complaints or anything that comes up, those can be handled one by one. But we're hoping to get everybody ready and set to be able to start on Friday. And like you said, logistically, yes, that looks like a lot, but I think because we're making the website so thorough and making sure those boxes are checked, it won't be individually, oh no, this is a no, this hasn't been done, et cetera, et cetera. It should be a quick, here's the information, generate the certificate.
So this is really a self-examination.
Yes.
That we're relying on the businesses to do the right thing.
Correct.
Okay, thank you.
So, real quick, I don't know who this is for, but Hayfork side, bar and grills, that's big. And I know a lot of our bar and grills really live on the bar side. The second question is our farmers market. If you could address that now. If you can't, then maybe next time. But we're going into farmer markets, and the farmers have been, you know, they've already planted their seed. They're getting ready to have the produce and their wares. So could you address those two things?
Yeah.
I apologize.
On this statement, I know. Go ahead.
So I believe that bars are still in that phase 3, and that does create some complicated issues with the bars and grills, like you mentioned, but I believe they're still able to sell to go if they do serve food. On the farmers market, we are working closely. In fact, I have a meeting with Sue Corrigan and addressing the farmers market. Farmers market was listed on the essential list in the beginning, and they have came up with a great strategy to make it safer for customers. And I see them very similar to a grocery store. You go in there and you shop, you know. So they're going to be meeting the guidelines that we want them to follow.
Hold on, Supervisor Morris.
If you're done.
I'll go ahead after.
Okay. Thank you for that clarification on bars. On the opposite end of the spectrum, I know our churches have been very cooperative, and though they've been very patient, where do they fit in terms of, they've all been doing virtual Sundays, if you will. How do they move forward?
Yeah, and on that, the schools, just
Yeah.
the churches and the schools.
Okay, so starting with churches, the governor has been very clear that currently they're able to operate with their supportive services. So if there is a church that is providing meals or other service, that they can continue to do so safely as an essential business. As far as congregation and resuming a Sunday service, that is included in phase 3. And again, just really encouraging the virtual services as they have been doing. And as soon as we get an update or a change in that, we will communicate that with the public.
And Chair, I think it's important to clarify that as we're talking about opening, there's a part of our population that is very fearful, as you've mentioned. They're older, they may feel more vulnerable health-wise. I don't think the state released 65 and over from essential travel only. They can still operate in that essential. I think that's important for the public to understand. That group can still operate the way they've been. And if I'm not mistaken, the state has also not lifted the ban on non-essential travel. So that doesn't mean we can go on vacation to wherever yet.
Correct.
Do I have that right?
Mm-hmm.
Okay.
You do. And then to circle back on the schools, our health officer has prepared a letter that went out to the schools closing the physical classroom learning for the remainder of this academic year. In phase 2, the governor has not provided guidance, but they have discussed in phase 2 at some point providing guidance, further guidance to schools and daycare facilities. So we're staying tuned to that information. And they have also introduced a proposal to start the academic year early, perhaps July. I understand that there is a lot of conversations that have to go with that. He made that introduction and hasn't really said much since then.
So do we know about graduations?
We do not know about graduations at this time.
Thank you.
Yeah.
Thank you. I think that wraps it up. So,
Okay.
and one more question. I
One more.
apologize.
Okay.
I didn't see your finger there.
So what is this phase 2 going to do to our 14-day in self-quarantine for outside?
I'll have Marcy speak to that. The quarantine is in medical parameters.
That's our county issue.
Thank you, Supervisor Groves. So the quarantine issue, from a health department perspective, has to do with ensuring people that are around others in our community that potentially might be positive and can spread the illness, not be able to do that. From a policy standpoint, an administrative standpoint, those are decisions that the county as a whole makes in consultation with the health department, the health officer, our CAO, our board. So beyond the relative quarantine issue, from a public health standpoint, that goes back to testing, contact tracing. We have health officer orders that we will implement for quarantining and isolating persons necessary based on the testing and contact tracing. From a policy standpoint, I think that question really belongs with Richard and our health officer around what that's going to look like in the context of modifying our stay-at-home orders.
Yeah, I can, not speaking for the doctor, but as Christy alluded to, that would, if we lift our travel ban within Trinity County as we have right now, that would kind of contradict some of the new orders coming out in phase 2. So it would be my assumption that the 14-day quarantine would be removed. I don't know that for sure, but just looking at all the evidence we have, talking to the doctor, and what we're presenting, that 14-day would contradict everything we're doing right now. So my assumption is that 14-day quarantine will be lifted.
Thank you.
That brought up another question.
Sorry.
Again, I have one more at the very end. So.
Okay.
So with what you just said, we might lift our own local order of travel. That doesn't mean the state has lifted theirs. So there's that contradiction, meaning how, I don't want to give the wrong information out there, like come up here, which we've seen already, and I hear from our public that they are very worried about infection rate increasing with people traveling into our county. So I don't know how we manage that.
Our 14-day was more restrictive than the governor's. So what we'll do is we'll go back to the
Right.
governor's orders, which they'll still have the non-essential travel, but we'll go down to the minimum of the state rather than be more restrictive as we've been here. So that's for that one. And one thing we do need to take in consideration, and I hope I'm not jumping lines here, this is Marcy's presentation, but with this, the public does need to understand that as we move in a more aggressive manner to open up, we do expose ourselves much more. And with the increased testing, the odds of positives increases. So all of a sudden we are testing, what are we supposed to be testing, 100?
26 per
Yeah, 26 per day, and we have people moving about the community. There is a greater chance of receiving positive tests, and there will be a number there that if we do receive, we will have to tighten up our restrictions again. So with this, with listening to the public and trying to take their concerns in and move forward as quickly as possible, we do run some additional risks.
So with that, I'm going to thank you for the update. It's like navigating through uncharted territory, and at any moment there will be a monsoon, and to balance all that. So I know that the public announcements on Friday are going out. Thank you, Dero, and social media. And people are concerned, and people need to provide an income. So it is a balancing act. So I appreciate that. And we're going to go backwards now into public comment. And,
Do we have comment on this item?
well, it's public comment in general, but there was a lot of concern. And so in order to perhaps answer questions of public. And so I had 4 people in the public. And I know that right now we should be going into our 10 o'clock, but Margaret, unless you stop me, I'm going to go ahead and proceed with public comment, and then I think I'm going to move Mr. Dillon to the front because he's here waiting very patiently, and it is a wonderful presentation. I've seen it, and so I'm going to move him up. Margaret, is there any reason why I can't push back the county matters at 10 o'clock? Okay, so public hearing at 10 o'clock, I'm moving back until we have completed our morning consent as well as presentations and proclamations. So now I'm going to open it up to the public comment, and I had 4 people. I begin with Diane Richards, public comment. If you're on the line.
Yes, I am. Do you hear?
Yes, ma'am.
Thanks very much. I'm in possession of a letter that from our North State leaders, and they sent to the governor a 2-page letter, and it sums it up that we appreciate your consideration of our request to reopen the economies in our 6 counties under local orders developed in concurrence with local county health officials. Thank you for your consideration of request. And what's missing here is Trinity County. We have Sutter County, Yuba County, Duluth, Butte, Tehama County, and many other cities. And yet we did not get that, and we have no cases. And I don't know if, with all this fear-mongering, basically, that's happening here over at risk, do you understand that the national doctors that we're relying on, they participated in a coronavirus project in the Wuhan laboratory in China where this originated. So I really do believe more, and you are violating, yes, as you admitted, violating our rights to assemble, our freedom of religion, to congregate, to practice our religion. And one of your, one of your officials was there today, oh, we're going to work to restore your freedoms. You have no right to take us. And what's very ironic is that you can go down to Reading to buy a pair of shoes in Walmart, but you can't buy in Trinity County with no COVID cases at all. The irony of that, there's no common sense here, and we'll just basically run roughshod over our freedom. And if you think that we have not had in Trinity County, I'm pretty sure with January, I've interviewed many people that were quite sick in January. We didn't have the dead street. And in Cisco, I also interviewed a lot of people, and they had it in December, January. There were whole businesses that were sick with flu symptoms, and they did not die. Wuhan has at least 2 flights, direct flights a day into San Francisco. I believe that was ground zero, and there are not that there. In fact, I spoke to an 85 black man. Hey, I've got this thing before. Now you have to establish your immune system. That's the way it works. And he shrugged and said, hey, we'll be okay. At work, he never even suffered for being sick a little, and he's back at work. We need to get our people back at work where you can even go buy a pair of shoes. You can go buy cannabis, but you can't even buy a pair of shoes. For essential business parameters that we have, but it's an essential business because we need to work, money, and be able to go to church. I urge Jews to the other counties.
Mrs. Richard, your 3 minutes is up.
Right away.
Diane,
Thank you.
and I would request that you send a copy of that letter, forward it to Dr. Coons and myself so I can look at it. Thank you. Chris Schaefer, I have you up next. Are you on the line?
Yes, I am. Can you hear me?
Yes, ma'am.
Oh, thank you so much. Unfortunately, I was having a lot of difficulty hearing the presentation because of the feedback. However, so please forgive me if I ask some questions or make some statements that have already been addressed. My concern is that we've seen some essential businesses that have remained open, and as a person in a higher risk category, I have chosen to stay at home as much as possible. But unfortunately, one has to go to the pharmacy or the grocery store, and I have seen so many people not respecting the recommendations that have been made. A great number of people do not wear face coverings in public. There are efforts made to maintain social distancing by some of the establishments that have been open. However, when those start to break down in the actual real world, I'm not seeing any intervention as far as, actually approaching a person and saying, excuse me, this is what we've got going here and this is what we need to do. A lot of our businesses that may be opening, I'm very sympathetic with the issues that they're having as far as getting, getting food on their tables. However, I think we also need to look at some of the physical environments do not allow for social distancing. Perhaps a very monitored number of individuals that would be in a store at a certain time would be adequate to resolve those issues. I hope that the businesses that are able to reopen are very diligent as far as following the plans and plans that have been set forward. I did not hear anything about masks being, if they were going to be mandatory in an indoor space. I hope they are. I know that Humboldt County instituted that for all indoor gatherings, in stores or whatever, banks, etc. And I think that's simply a respect for our fellow citizens. Thank you.
Thank you, Chris. And I would encourage you to get on the governor's and the California Department of Public Health websites, and they're not mandating it in California on the mask. And Dero Forslund YouTube hopefully will have today's presentation, so if there was something you could miss, as well as anybody else on the line, you can go back and watch it there. And I appreciate you closing early. I'm moving on to Colleen. Colleen, are you on the phone?
Colleen Sullivan, can you hear me?
Yes, Colleen Sullivan, thank you.
Great,
Welcome.
thank you, and thanks so much to all the county employees who are doing a fantastic job of keeping us updated and informed and providing access to these kinds of forums. Really appreciate it a lot. Thanks to all of you. I just want to echo Dr. Cruz's example of the gym as maybe a business that could open with precautions in place and be self-certified perhaps with the approval of the local entities. I've been going to the gym for a very long time, and Kelly has trained all of us very well to be clean and sanitary for years, and we practice that on a regular basis. And with the space that she has and the kind of sanitary practices in place, I think we could carry on in a limited manner and provide that service to those of us who go there. Those are my comments, and thank you very much for providing this forum.
Thank you, Colleen. Michelle from Coffee Creek, are you on the line?
Yes, can you hear me?
Yes, somebody has, wait 1 second, we'll start you in a second. Out on the protest line, mute your phone. Please mute your phone. Thank you. Michelle, I don't know if you can hear him or not, but if you can speak loudly and clearly. Thank you.
And I appreciate having this forum online, but it's been very hard because people weren't on mute. So I have a few questions you might have gone over, but I just want clarification. I own a small resort in Coffee Creek. I want to know, did you say we can open as of May 8th?
There were no dates given.
Okay.
That's the goal. That's the goal, Michelle.
You don't have any dates for resorts to open?
The May 8th is a soft goal. It's a GOAL, a goal.
Okay. what about this, is the travel ban going to be lifted for the county?
Yes, ma'am.
And we know when that is?
We're hoping that Friday online there'll be information. We're working to put this information online, and then there will be a certificate that you will fill out, and the more yeses you have, the more easily environmental health will be able to push you forward. We realize that there are a lot of businesses all in line at the same time. Sorry you couldn't hear that.
So the form is not ready yet, but it should be online by the 8th?
It will be this week.
It'll be this week, and the 8th is Friday, yes.
Okay, and do you know if on the form there are requirements, cleaning requirements needed, OSHA requirements for cleaning cabins?
Yes, ma'am.
PPE, cleaning for my employees?
Yes, ma'am. And what I would do is I'll defer you to Christy Anderson, who's in charge of our environmental health. If you could call her and have a private conversation, I think that would expedite your questions.
Well, I have tried and haven't gotten calls back, but I will try again.
I apologize, ma'am.
We have, the problem with us is we have reservations from last year, and I don't really know what to tell people right now. So, we're pretty much booked for the summer, and I'd really like some dates.
Yes, ma'am.
Open.
We understand that, and the team of professionals that Trinity County has put together has really been on the forefront. And I apologize that you haven't received answers back, but they have been swamped. Christy's here. She has seen me. We're acknowledging, and she will be in contact with you today.
Okay, I will call her and leave another message just to make sure. But so right now we can't tell our guests it's the 8th that they can come on down. I guess is what.
That is correct, ma'am.
Okay, but hopefully by Friday we'll have some dates.
Yes, ma'am.
Okay, thank you.
Thank you. Is there any other public comments that are on the phone that did not give me their name?
I didn't. Yes, I gave you my name, but I wasn't called.
What was your name?
Joanne. I have
Okay, I hear a Joanne, and there was somebody else in the background at the same time.
And a Marga.
Okay, I got a Joanne and a Marga.
Yeah, and Janice.
And a Janice. Thank you for being so patient.
Julia.
And Julia. Julia Baldwin.
And Bill Burden.
Hi, Bill.
Yeah, Julia.
Okay, we're just going to go in the order that we received them, and I appreciate your patience as it's difficult to hear on the phone, especially when there's background noises and traffic and honking. So, Joanne?
Yes, thank you. I would really love to thank everyone who's been working on this out of the county with response teams. It's just been amazing. And I don't know you, Marcio Cantil, but you are my hero right now. I appreciate you keeping a real health and science aspect on this whole thing. So I'm a business owner. I had a storefront that I closed last year downtown, and we were just still have a business the other end of town I'm waiting to be able to open, and I also sell online. I've worked to try to help revitalize the downtown, and I think I have a sense about the businesses, but I would urge everyone to keep an eye on the prize. It's not about finishing this door and opening that door. It's not really what business owners want, even the ones who had recently about to open up. But they really want is to, in the county, quote unquote, whatever.
Joanne, did we lose you? Joanne, if you call back, you have 1 minute and 50 seconds reserved for speaking. I don't know if we lost anybody else. We're going to go on and move to Marga. Joanne, when you come back on, if someone's speaking, just let them finish, if you can hear this. And We're gonna go to Marga. Sorry, Joanne.
Margot from Trinity Office.
Okay.
Can you hear me?
Yes, ma'am.
Okay. I just basically want to reiterate everything that was said, the person before Joanne. I came in just after she started, and I wasn't 100% clear on, are we opening the 8th, or on the 8th is when we're getting dates?
8th is when the governor's allowing us to move to phase.
May 8th is when Governor Newsom has allowed us to move forward. On the 8th, we will have an online application that the business owners can fill out, send back to environmental health, and then depending on your answers will depend on how soon you personally get to open up.
Okay, and what website is that form on?
TrinityCounty.org.
I'm sorry, you got a real echo. Trinity County what?
.org.
Okay. So you think we will be open by Memorial Weekend?
I don't know your personal business, and so it's hard to say. Christy's going to have to go through those applications.
Okay, thank you.
Joanne, did you get back on? No, we're going to go ahead and go to, I think it's Janice?
Yeah, I'm here.
Welcome.
Okay, I have a real problem with people not being able to earn a living and, you know, provide for their families. The Board of Supervisors has previously had a good relationship with the small businesses in Trinity County, in Weaverville, and it's been a relationship of give and take for a while. And these businesses are now begging for approval just to pay their bills. They're not going to be able to survive. They pay rent on their buildings. You know, they're still having to pay utility bills. And they're not getting any income. And if they don't get to open soon, they're going to turn out like the recycling center and close permanently. And I don't think we want more businesses to completely be gone. It's crazy, you know. Some people say it's to protect public health. Well, there's a lot. Many diseases out there that are contagious, and nobody can see it. They're not outwardly obvious. And nobody thinks about those. I mean, there's staph, there's strep, and in certain populations, those can be deadly. Hepatitis C. If an adult has whooping cough and is around a baby, whooping cough for an adult is nothing. They may not even know it. But it can kill an infant that hasn't had the immunizations yet. And nobody seems worried about that. And you remember the 80s when they first came out with the HIV/AIDS epidemic and outbreak? First they said it's only gay men. And next, anyone can get it, all bodily fluids that a lot of people carry. They said it was tears, saliva, everything. You know, don't share utensils. And then, you know, that's what the experts said. Everybody believed it. And boom, what was it, 2-3 years later? Oops, we made a mistake. We're sorry. You can't catch it from eating off of their utensils or whatever. But you know what? The damage was already done. Many people refused to go with the new explanation from the experts. And there are still some older people today that still believe it. The damage is done. They can't take it back. And that our state and federal experts plus the world health people are constantly changing their stories. And for me, that kind of brings the credibility into question a bit. Most people don't.
Ms. Janice, your 3 minutes of public comment are over. I'm going to ask if Ms. Joanne is back on the line.
Can I continue?
You have 1:30 remaining, ma'am.
Okay.
Is that Joanne?
The small businesses would like to know how.
Oh, wait, Janice?
Care
Well,
about plans.
is this Janice or Joanne?
I'm Janice.
Okay, Janice, your time is up. The phone dropped on Joanne, but not hearing her, I'm moving on to Julia Baldwin.
Hi, it's actually Julia.
We have open phones in the background. If you could please mic, especially if you're out on the highway. Go ahead, Julia.
Okay, can you guys hear me okay?
Yes.
Okay, cool. Like everyone else, I want to thank you all for all the work that you're doing, board supervisors up to included. And especially trying to set up this horribly annoying call, but I appreciate your working through to make sure that we still get to give our comments. A couple of thoughts. So one is, as you can hear from some of the comments and I'm sure some of you are on Facebook and we have a conversation, there's a lot of panic, there's a lot of fear, there's a lot of misinformation out there. I do want to make sure that everybody knows that voices that want us to make sure that we move at the pace that we need to move to protect our community.
Julia, are you on a speakerphone?
I am. Let me get off speakerphone. Okay, is that better?
Yes, ma'am. Thank you.
Okay, oh wow, that's interesting. Okay. That there's a lot of voices out there that want us to make sure that we are data-driven and science-driven and move the pace that's necessary to not only keep our community safe, but also to help our economy, because to be honest, if we have an outbreak here, whatever we think we're suffering now economically is going to be so much worse. And so being safe and moving at a safe pace actually is important for our businesses, regardless of how painful it is to get there. I have a couple of thoughts. So one is I do want to help our businesses. One thought that I have that has been circulating, but no one's really taken leadership on it, is should we have some kind of committee or group or something that can help businesses pivot in the short term, whether that means going online, which is not a small task for a business to do, requires help and probably some money. But also, should you provide different services for the next few months, or should you space for something completely different from the usual business model? And there's all sorts of ideas that are taking place in other communities where businesses are temporarily pivoting to get at least some income. I'm not promising every business to do it, but I feel like it would be worth an effort to actually sit down with each business, each industry, and figure out what can we do in the short term to stave off some of these harsher situations. And then in terms of misinformation, I'm wondering if there could be a public service campaign. I'm seeing even at the businesses that are open now, some of the business owners and definitely a lot of patrons are not following what we have in place at the moment. And I think a lot of it is due to the misinformation as well as some of these passions that are starting to arise. So their second thought is could the county fund some kind of campaign to continue to keep people informed about how to stay safe? And that's it. Thank you again for all your help.
Thank you, Julia. Bill Burton?
Hello, can you hear?
Yes, sir.
This is Bill Burton. Hello, supervisors.
Go ahead, Bill. We'll come back to you, Joanne. Go ahead,
Hello,
Bill.
supervisors. I would like to state that I think this contagion is not advancing as much as some of the media presents. And what I think we can do here is look at we can do a very careful, it's like an experiment for California. As we open, and we should open, is what I believe we should do, and in this careful process, we will be an absolutely good data point for the state of California if we do not develop more contagions. It supposedly the test gets lots of false positives, and so I fully expect some positives to occur, whether they're true or not. I would suggest that we double check any positives we do get. And then what Chris was talking about with going to the pharmacy and stuff, I'm in a place right now where it's open in pharmacies. I'm not in the county right now. I'm actually overseas, and I'm happy to hear try to open. And anyway, overseas they have open pharmacies. and they are allowing you to use masks on option. And the other thing they're doing is they're allowing you to take appointments to arrive individually, both either way, and appointments for seniors or people at risk, individually, and maybe at early hours or mid hours, or each store can kind of create an environment like that. So I'm just trying to say, have confidence, and my experience has been the contagiousness of this after traveling across the world and stuff hasn't hit me, and I've been just doing the careful hand cleaning. It's really contact to being the most quick way of catching this. So, and keep a good exercise and good immune system, everybody. In Trinity County, you can do that, and we have a social space. That's what I would like to see. I just have it open again.
Thank you, Bill. Enjoy your travels, and when you come back, if COVID's here, we'll have to see each other after you are isolated.
I think it'll be quite isolated. This summer, I think we're gonna.
Okay. Well, I hope you and yours are well and healthy and stay that way. Thank you, Bill. Joanne?
You.
Joanne, did you come back on?
Yes, can you hear me?
Yes, you have 1:30 remaining. I'm sorry about that. We technical difficulties on whatever end. Please start.
Okay, well, I'm not sure how much of what I did say got through. So I'm a business owner downtown that I closed. I'm still waiting for the opposite end of town.
Somebody's got us on hold. Sorry about that interference, Joanne. Continue. We lost you again, Joanne. Okay. Somebody has us on hold, and your mute is on because you can't. You're not talking, but we can hear your whole button. We have all received emails. Supervisor Morris would like to read one into the record.
And I will have one also.
And thank you. Does any of the other supervisors have one? Okay.
No. Thank you, Madam Chair. This was, they sent it to me versus trying to deal with this phone business. So, dear Supervisor Morris, it is my understanding that the Board of Supervisors will be discussing proposed actions for complying with the State of California Stage 2 phase of the state stay-at-home orders and lifting or modifying current stay-at-home orders from Trinity County Public Health. I understand that many in this county are suffering financial loss during this time. I also know that aid to small businesses from federal and state sources have not materialized. Without adequate testing and resources, it may appear that the coronavirus is not in Trinity County. Because of that illusion, many business owners and others feel that this county should not be shut down. The governor and state of California had announced that the state has succeeded with stage 1 of the plan to reopen our state and are prepared to move to stage 2. During the last 46 days at stay at home, I observed that perhaps only 50 to 60% of our population complying with mitigation measures. In addition, visitors seem to not comply at all, perhaps because they think if they aren't in their own town or state, it doesn't matter. In addition, I have not seen any official or unofficial enforcement on these measures. The USFS closed campgrounds in other areas, but there are no patrols or enforcement. We were asked to social distance and wear masks, but again, no enforcement by business owners or anyone else. In fact, employees are lax in complying. So my question to this board is this: if you open more businesses, what are your plans for enforcement of mitigation measures? Whether that is numbers of customers, barriers, or masks, or cleaning, or other restrictions. Visitors are already here in the county. They came from states and other parts of the state. Even if you believe we don't have the virus here in Trinity today, the influx of travelers make that situation a moot issue. Thank you, Constant Corp.
Thank you.
Thank you.
Supervisor Groves?
Yes, dear Trinity County Supervisors, as a family business who has lived in Trinity County for 44 years, we need to rethink our position on staying closed. These are the facts. People are coming into our county from out of the area and not sheltering in place for the 14 days required. They're coming here as our reports say there is no virus. The surrounding counties have these stats on the virus, have opened up. Modoc County, 9,000 people, 0 cases, 0 deaths. Sutter County, 31 cases, 2 deaths. Yuba County, 19 cases, 1 death. For the first time in my history as an innkeeper, I turned somebody away in need, which is a violation of the innkeeper law. I have 2 families call me this last Saturday in the middle of a downpour from Big Flat. They were camping and had a 5-month-old and 3 other children and 4 adults in dire need of a place to stay and get warm. It broke my heart to tell them that we could not help them and they would have to go to Reading as no one was allowed to be here except essential workers. Technically, if they knew the law, they could probably sue the county, virus or no virus, for not letting them seek shelter in a timely manner. Yes, the virus is bad, but we are not acting in the best interest of the county. If you ask county residents and your friends, you'll find out the virus has already been here. I had all the symptoms, but thought it was a bad flu. Please take all these facts and weigh them against what's best for our economy for the county. Thank you, Ruth Hartman, President, Coffee Creek Ranch.
So, no more public comment. I'm going to bring it back to the regular board. I would like to ask Dr. Coons, the comment made about other counties that have opened up, could you explain the potential problems that Trinity County might receive or endure, I should say?
Yeah, the other counties that went ahead and violated the governor's orders could be subject to either reduction in reimbursements, could be in lack of services. As I said, we will have funding that will come not only to the county proper, but to the residents of the county to help in small businesses. Those could be reduced or eliminated. And the big one, I believe, is if they have a surge in that area of COVID, that they could be held personally responsible for violating the health orders of the governor.
So with that, I'm going to close public. Oh, Dero, I apologize. I didn't see you.
No, that's fine. I just wanted, you're dealing with a lot of stuff with feedback and all kind of stuff, but there are in excess of 30 people watching online, so on the streaming. So there's a lot of people that are going through this process. So thank you.
So just in public comment, you can hear the multitude. If there was a graph from 0 to 10, there's somebody on each number. And to navigate and to govern a county and to administrate and to follow the federal laws and the state laws and to be cognitive of the fact each and every one of us has family members that have been impacted, whether it's grandchildren that you're homeschooling or someone you love who works in the health industry that can't come home because they're an essential worker, or our local law enforcement, the way they've even had to put together their teams. So the county has responded. The fact that we don't have any one tested with COVID does not mean that it's not here. We can't be responsible for people outside our county, but the people of our county, the citizens of our county, have stepped up to the mark. And for that, we are grateful. We knew that this was going to be a marathon. It's not over yet. We are sorry for all the inconveniences, but each one of us and everybody, every staff person, including the team members that are looking out for the best interest of Trinity County citizens, have all felt it personally. So we do understand. We want to be up and running. And with that, we are going to move on. And we're going to move things around a little bit.
Madam Chair?
Yes, sir.
So what exactly are we leaving this at, this plan?
Plan is to, on the 8th, be up and running online.
Yeah, I mean, do we need to endorse this plan?
No, this was just they were just telling us what was going on. It was, unless I'm wrong, it was receive an update regarding.
Marcy had mentioned that looking to direction from the board.
Okay, well, let me look at the backup. I have it as receiving an update. Receive an update regarding the coronavirus. There was no recommendation from the staff. Marcy, would you like to come up, and do you want us to do a formal vote? Or I'm not sure. It's just on the agenda. It says receive an update, and we've received several. Yes, Supervisor
The
Finley.
agenda item was very broad. I prefer that you leave it like that. There's nothing else going on. I had to ask CAO whether this would be part of the item, so the public really was not made aware that we were going to talk about this today.
Other than receiving an update, and that's
We
all we
weren't
did.
going to talk about
So
reopening or the plan.
that was part of the update. So I believe that Supervisor Finley is correct, and it is on the agenda, and therefore we have not, it's not in our consent. If you would like us to authorize something, then I would have you contact CAO Coons. I just made you a supervisor.
I don't know if that's a
And I'm
motion or
stepping
motion,
aside.
So Supervisor Finley is correct. We did not know until last night we were going to be discussing reopening, because that's what the governor came out yesterday at noon, moving this to phase 2. So it says presented on here as an update from where we were headed, which we discussed that each week we'll give an update. This is very fluid, it's moving very fast, so that's why the presentation of possibly opening up much quicker was on today's. So what we're asking from the board is to give an update and just solicit input from the board as to what direction, if there's any further direction you'd like us to look into as staff. But from an action item, no, but we always solicit input from the board.
I think that you heard it from the public and from the board that we want to accelerate as quickly as possible while making sure and ensuring that we keep the public as safe as possible. I don't know how you walk that tight line, but Supervisor Groves, did you have anything to add to that?
I will just say that I feel a little uncomfortable, and I understand John's point on the broadness, but I do feel a little uncomfortable that this doesn't get an okay from the board at some point very soon, because it seems to me this is our role to set the direction of what staff should go, and without our endorsement or non-endorsement, I think we're acquiescing our responsibility.
Yes. So, I'm sorry.
I mean, ultimately, we certainly gave feedback, but ultimately, it's the public health officer who's going to sign off. My sense is that we are slightly in agreement on moving forward and getting the website up as soon as possible so people can start moving in that direction. Because ultimately, and correct me if I'm wrong, Dr. Coons, this is a public health officer will do the final sign off on this. They just wanted to see if we were totally against this or for it or a variety of in between.
Correct. Make sure I'm correct. Yeah, the health officer will be changing his orders and accommodating for the phase 2 of the program, for the governor's recommendations.
Supervisor Finley?
What about a general statement saying that we unanimously support what's moving forward? And if we want, we can have a special meeting on Friday.
Yeah.
Most
Yes.
of us over the phone and say,
Yeah.
please move forward, or Thursday. More than
And there may be more info.
offer as much support
There'll be more
as,
info.
as Keith wants to put forward. It's
I-
important.
I would prefer the special meeting on Friday, because the public has the right to complain to somebody and they don't have access to the public health officer.
Supervisor Coons, can you?
Supervisor again.
Supervisor, sorry. Tina, would you pull the board after this meeting, make sure that we're all available, and some of us might be on the phone. So, Dr. Coons, is your Friday open?
It will be.
Margaret, are you available?
I am, that will work just fine.
Thank you. So
I'm a little confused.
we are going to have a special meeting on Friday and allow public to have feedback on this specific item of receiving and accepting and moving forward on the accelerated lifting that the governor is allowing us to do.
Where are they going to get that item information if people weren't joining us today?
we're going to have it put together real quick for a special meeting on Friday.
And then my other question, I don't want that to hold up the web portion
No,
application.
nothing is being held up.
Okay, got it.
Nothing is being held up. We're moving forward, and then we'll bring this back to the board to allow, as Supervisor Grove said, for the public to have official input, because this wasn't in the backup.
Got it.
And there wasn't a action item. So, once again, thank you, and I'm really trying to get to Dylan. And so, having heard no more requests or comments from the board, I'm going to go ahead and we're going to move. Okay, we're going to have to accommodate you as fast as we can. This presentation of 1.5, receive a presentation from Dylan with the Watershed Center regarding Trinity Community Protection and Landscape Resilience Project Phase 2. As I mentioned earlier, I was able to see this, and I actually encouraged Dylan to come and present. At the time, COVID hadn't happened yet, and so this will be going online, and you'll be streaming, so just so you're aware of that.
Great.
Thank you, Dylan.
Thank you, everyone. Thanks for your time. I'm going to change the subject a lot bit here. This is super important, unprecedented times right now, but as we know, fire season doesn't wait, and we've had some recent fires already. My name is Dylan Sheedy. I'm the Forestry and Fuels Program Director at the Watershed Center, the Watershed Research and Training Center up in Hayfork. We're a nonprofit organization, and I hope that some of you know about the Watershed Center and the type of work that we do. If not, I'd be happy to continue the conversation via phone call or email or something. As Bobby mentioned, I gave this presentation in the Trinity County Fire State Council meeting. It's a public forum for local land managers to gather each month and prioritize projects, talk about them, and try and collaboratively work together to complete them. I'll note too, this is, as you can see, this is a phase 2 project. The Watershed Center just completed the first phase of this project, which started in 2017. And this all, started as a kind of an landscape scale kind of management initiative started by the Trinity County Collaborative Group in 2010. And so this kind of initiative has leveraged millions of dollars in state and federal sources to implement meaningful field reduction work in Trinity County. Phase 1 of this project, we were successful in completing about 4,000 acres of treatments. That includes 2,000 acres of fuel reduction work and 1,000 acres of reforestation and some biomass utilization work. This phase 2 project was put together. We were awarded it in March of this year. It's essentially just picking right up where we left off, increasing the scale, the scope, and the overall impact of this project across Trinity County. So these funds are for CAL FIRE. They call it the CCI, California Climate Investments. It's a forest health grant, and it's money from the California carbon cap and trade market, and it's money that's directly invested into low-income, disadvantaged communities to do work like this. You have to have some type of greenhouse gas reduction benefit through these projects, either through reforestation of severely burned areas or fuel reduction to prevent large wildfires, stand replacing wildfires. So this is the point, it's kind of the overview of this project. As I said, this is an increase in the scale and scope. This phase 1 project, we only did it with the Forest Service, and as you can see, we have multiple partners on this project, including the Forest Service, Sierra Pacific Industries, the Trinity County Resource Conservation District, and Trinity River Lumber. You can just switch it.
More technical problems.
There we go. So we were awarded a total of $3.8 million. It includes some type of match from Forest Service, so the total grant is close to $5 million. The performance period is 4 years, so we have this money until 2024. You can see a map there of the project areas to the right. The kind of the beige boxes are the general project areas. The black areas are kind of the specific areas we're trying to go to and treat. Now, we're not going to treat all those black areas. We're treating a certain amount of acres in those areas. Those are just kind of our general focus areas. So our partner is $1.7 million to Shasta Trinity National Forest, $1 million to Six Rivers, $300,000 to Sierra Pacific Industries, $200,000 to ourselves to do prescribed burning, $100,000 to the Trinity County Resource Conservation District, $15,000 from River Lumber. So they're all, funds coming from CAL FIRE directly being invested into these organizations to implement some type of project. I'll go over those projects too. So there should be some words up there. Well,
Do you want to use one?
is it on there? Is it
Yeah,
mic up
it's
there?
on here.
Is it?
The shaded field break.
Yeah, okay, so it includes 4, I can probably go over it.
There you go.
It includes, sorry, I didn't memorize this presentation, 5 distinct fuel reduction treatments, so shaded fuel break construction and maintenance. This is on strategic ridgetops and roadways throughout Trinity County. Shaded fuel breaks, you maintain the overstory canopy and you reduce the fuels in the understory to discourage a crown fire and allow for easier kind of firefighter suppression and access. It also improves ingress and egress for local residents in the case of an emergency evacuation. Plantations, this includes Shasta Trinity, pre-commercial thinning and plantations that were established in the 70s. All throughout the Middle Hayfork Plantation and the West Side Plantation, they call them. Reforestation on old fire footprints, mostly in the 2015 fire complex, and prescribed burning, both on public and private lands, and biomass removal and utilization. So the total project will include, about 6,000 acres of total fuel reduction treatments. You can see the number there, 5,400 for Forest Service public land, 922 acres for private land. The treatments that we implement are listed there: hand thinning, mastication, hand pile, machine pile, tree planting, pile burning, broadcast burning, biomass removal. And as I mentioned, we have 4 years to implement this project. I'll just go through these maps quickly and talk about them. This is Shasta Trinity National Forest. This is the old Car Delta footprint there, County Road 106. They're doing a 100-foot fuel break on either side of that road to reduce the hazard fuels and prep it for plantings. This is also the Car Fire Delta Maintenance Project, so they're trying to restore this severely burned area, make it safe for travel, and allow for future planning projects. The Lake Forest Fuels Project, this is with Shasta Trinity National Forest, Tim Ritchie and Laura Graham. This is prescribed burning around Covington Mill. The red units are the burn units. This is Weaverville Community Forest Fuels Project. You can see the treatments surrounding. We try and make these treatments strategic around the community to protect from wildfire threats. The red is prescribed burning that will happen over the next 4 years. The yellowish is thinning and hand piling. And there's some fuel break work on Rush Creek Road. This is the Weaver Creek. We're calling this the Tucker Hill Fuel Break. You guys might recognize this area. This is going to be completed by the Trinity County Resource Conservation District. The point of this project is to allow kind of an escape route for residents in this area in case a fire starts on 299. They have another way to get out and they're not trapped. So we're going to make a huge kind of landscape level fuel break there, working with those landowners to improve kind of emergency evacuations for the public. This is SPI, the Wells Mountain Fuel Break. This is top of Hayfork Summit here. They're doing about a 400-acre fuel break. Real strategic spot for them. As you can see, it's protecting a lot of their timberlands, but it's also a strategic spot for the Hayfork community. And they'll be implementing this hopefully next year. This is project areas near Hayfork. These maps will be made available to you too, if you guys want to look at them more. Those are just the treatments, some tree planting. I think I have a laser, maybe nice. Some tree planting. This is the Kellogg FMZ, this fuel break that's around the community of Hayfork. They're going to be doing prescribed burning maintenance treatments in there. This is the Big Creek Ranch. The Watershed Center and CAL FIRE are working on implementing over 400 acres of prescribed burning there over the next 4 years. This is the Tule Creek Ranch in Hayfork. Again, we're looking at trying to implement about 200 acres of fuel reduction or prescribed burning treatments. Middle Hayfork plantations. This is the PCTs that are happening in the plantations. And I believe this is the Stafford Fire footprint. They're going to be doing some tree planting. Highland Palm. We've got some more tree planting. We've got some more plantation thinning. And we have some prescribed burning planned on Bar 717 Ranch right here. We'll try and burn about 200 acres there over the next 3 years. Picket Fire Reforestation, they're going to be planting here, thinning and hand piling for future planting operations. This is Dubakella down by Wildwood. Again, plantation thinning, hand piling, and some biomass removal here as well. It's going to go to hopefully the Anderson biomass plant to produce some renewable energy. This is Southern Trinity County near Ruth. This is with Six Rivers National Forest. They have 3 main project areas here. First 48, Kelsey Peak and Beaver Slide. The red is going to be prescribed burning. The rest of this stuff is all shaded fuel break work for the community up there. And that's kind of the gist of this entire project. It's very ambitious. We're trying to basically double our acres treated on the landscape and using partners to complete that work as well. We rely on seasoned partnerships with the Forest Service, the Conservation District, and new partnerships now with SPI and Trinity River Lumber to implement these landscape level projects that protect our communities from wildfire threats. I think that's about all I had. If there's any questions.
Are there any questions, supervisors?
Or comments?
I just want to thank you. I was really wanting a comprehensive overview of what's going on in the county on these projects, and thank you for mentioning the collaborative and their work to get some of this stuff moving. So it was very helpful. Thank you.
Great. Awesome. Thank you, guys.
Thank you for
Thank
waiting.
you for your patience.
Oh, no problem. I appreciate your time.
Really great, thank you. So, Jeremy had to leave, so we're going to go ahead and move it back. I'm just going to read the proclamations.
10 o'clock.
Oh, thank you, it's 11 o'clock. We're going to move forward to our public hearings, 10 o'clock at 11:05. So if you're following at home, it's item 3.1. Public hearings. Thank you, Dennis. 3.1, conduct a public hearing to consider adopting a resolution which requests the local agency formation commission to take proceedings from the formation of a community service district to sustain ambulance services. No fiscal impact. Does the board have any? Is there any public comment? Seeing none, I bring it back to the board.
So what is, I can't recall, did we do this, the same procedure the last time when they came through?
They will, this is, like you said, Supervisor Groves, same procedure. It'll go back to LAFCO. They'll fine tune it. The hope is that this goes back to the to an election in November.
Okay, thank you.
I would entertain a motion.
So moved.
I'll second.
And we're going to, it's a resolution, but on all their votes over the phone, so people can hear us, we'll go ahead and do a roll call.
Supervisor Groves?
Aye.
Supervisor Moore?
Yes.
Supervisor Finley? Supervisor Chapman?
Aye. Thank you. Item 3.2, solid waste. Conduct a public hearing to consider taking action on protests regarding the number of units charged to residences or businesses for the solid waste annual parcel fees. No impact to the general fund. Potential reduction of revenues in the amount of $100 per equivalent unit from the solid waste enterprise fund. Welcome, Diane.
Good morning, Diane Rader, Deputy Director of Solid Waste. This is our second public hearing on the annual parcel fee billing, and it's giving the public an opportunity to question any units billed them on the billing that we send out on April 17th. We've used a new billing system this year with a new data set, so we're getting a lot of questions, and we're trying to work through a lot of our changes just to resolve them without having to come to you with them, and they're just figuring out what the problems have been in translating the data. And we'll continue to do that through June 30. And other than that, if there's anybody else that wanted to present a protest for it.
Thank you. Supervisors, any questions?
It's public.
Is it public, any public comment? Supervisor Morris?
Oh, that's not me, that's for earlier.
Okay, sorry, I thought I turned it off. So,
Thank you for holding the hearing.
yeah, thank you for holding the hearing. Thank you. Trinity County Transportation Commission, 3.3, conduct a public hearing regarding potential unmet transit needs that are, oh, I'm missing my next page. Tina, could you finish reading it? Apparently I lost.
That are responsible to, or reasonable to.
Thank you.
No fiscal.
No fiscal impact. So, Rick, are you on the line?
Rick, are you on the line? You guys can't be heard. You guys can't be heard.
Can you take it off speaker?
Okay, again, this is a public hearing regarding the potential unmet transit needs that are reasonable to meet. This is something that we're required to do on an annual basis, which is we analyze request unmet travel needs, and we analyze these travel needs, and we make a determination whether they are reasonable or unreasonable to meet. And so that's what we are trying to do is ask what are the potential transit needs that we have out there, and are those potential transit needs which are unmet, are they potentially reasonable to meet? So that is the purpose of what's going on. This year, though, there's a couple of things that are different than what we do annually. Like I mentioned, we've done it before. First of all, this year we had still COVID issues, and so we were not able to analyze data that will make the impact needs prior to the COVID. So we were analyzed, but at the same time, as of April 24th,
Rick? That, I don't know if you have the YouTube channel or something, but you're feeding back and we can't really understand anything you're saying.
The feedback is in the phone, not in here.
Feedback.
Somebody else has their phone.
Yeah.
So it's, call me. It's just-
Rick, can you just hold on a second and Dr. Coons is going to reach out to you and we'll put you on his private line and that way we can hear it better. Can you hold on?
Okay.
Thank you. Anybody else on the phone, please mute.
Do you want to take public comment?
We're not done hearing the report from the director. We couldn't hear him because of the phone. So, hold on a second. Here's the other.
Go ahead, Rick.
Rick, go ahead.
This is much better than the echoing that was going on with the other line. Again, I'll start over. This is a public hearing to listen to potential unmet transit needs that are reasonable to me. And what that is that we ask the public for a list of transit needs that are not currently happening, like for instance, a bus ride out of Hines Pond. We currently do not provide that service, and if someone asks it, it is an unmet transit need that we have. And then the second part of that question is it reasonable to me? If someone asks for a bus transit system out of Hines Pond 3 days a week, 3 times a week, is that reasonable to meet for budgetary capacity that we have? So that's why it has potential unmet transit needs that are reasonable to meet. Again, this is something that are required to do on an annual basis for our Transportation Development Act. And we have been doing it. It comes up every year around this time. Our usual process is we solicit to the public, which we have. Anything that we receive, we send it to the Social Services Transportation Advisory Council, which is the STAC, to analyze these and bring forth to the board. In this case, this year we've had COVID restrictions, so we were not able to analyze anything on April 16th to bring forward. But I also want to comment that as of April 24th, we have received no comments. But there is one big thing going on, and the reason why we probably didn't receive any comments is that we have an overlapping activity that is going on, which is the short-range transit development plan and the public transit human services transportation plan, which are coordinated plans. They're both being worked up. It's our 5-year service plan for how we're going to deal with transit. And those are things that are going on right now that are very active, and that will also be essentially mirroring this process, but with a much more bigger, broader picture of over the next 5 years. So today's purpose is to hold a public hearing and receive any unmet transit needs, and then what we'll do is we will have a follow-up resolution on the next board meeting, which we make a determine are those reasonable to meet and make a recommendation to the board, and then the board discuss and adopts the resolution. So we did have some plans that were identified in the short-range development plan that we're working on right now. They've left them in the manual, and I can't let you know they are so desired, but with that I can answer any questions.
Does the board have any questions? No. There is someone for a public comment, Rick. We're going to try to turn up the phone from the conference. If you can't hear, please let us know.
Okay, and I believe public captain is also there.
Okay, Polly, are you on the line? Hold on, Bill. Polly, are you on the line? Okay, Bill Burton, go ahead.
Thank you. Two little things. The unmet need of traveling from downriver on transit to Reading doesn't connect with any southbound connections like Amtrak. If you leave in the morning, you get downriver and try to get to Reading before Amtrak leaves. Amtrak has changed their bus patterns, and so you're unable to meet any southbound like going to Sacramento or anywhere else Reading until you wait till 3 in the morning for a train. So that's the unmet need that impacted me and other downriver people. The other unmet need is that in general, when transit is operating, there's lots of Caltrans jobs that delay the arrival times. And there's possibility of budget projects coming up, and I was aware of them through some contacts, and it turns out that Caltrans can pay for delay of like 15 minutes or more, or if you miss a bus connection or have to do something else to make your further transit, that could be at an expense of them holding us too long. And so that will be coming up as an evaluation over the next year, how Caltrans deals with delaying us too long on Highway 299. And we should follow up on that, and it is an unmet transit need when we miss our connections. So that's my comment, and hope you're all well.
Thank you.
Hi, this is Polly.
Hi, Polly, welcome.
And I was having technical difficulties on my end, imagine that. So I couldn't hear what the questions were, if you have any.
It was a comment that, two things, downriver doesn't have a connection to Amtrak to Reading, like the times don't set up. And the second was the potential of Caltrans paying for delays or missed, which is something that Caltrans is looking at. I do not believe that the Trinity County DOT can weigh in on that. That's an internal, but that is something that Mr. Burton was bringing to our attention to just have on our peer review.
And keep in mind that the Amtrak, you're going to have a bus down there, what, at 2 or 3 a.m.?
And that was his complaint. So it wasn't really a question for you to answer, but we didn't know that going in. It was a public comment.
Yeah, he was mainly talking about the bus services that they run the bus service during the daytime. That's outside the train.
Right.
Yeah, unfortunately, the Amtrak train does leave at 3 o'clock in the morning or something, so it's not something that ever connected to me. And
Right.
currently, there are hardly any connections already. But that's something that we're always working on, and the tough part is trying to make those connections with Amtrak and Greyhound. So, but we'll definitely take note of that and include it in our short-range transit development plan as well.
Thank you, Ms. Polly. Bring it back to the board. Closing public comment, and we're just receiving the public hearing of the unmet transit. So we received it. So now we're going to back up to item, I believe, 1.1, which is a proclamation. Let me ask Dero. Dero, are you good with us taking breaks?
Well, I think probably if you want to take a break, if you can, and limit it a little bit, because I'd like to leave the stream going, because I don't want people to have to come back on. So I just leave it going. So,
Okay.
But if you want to take a short
5
break,
minutes?
that's up to you guys.
So it's
But
11:20, we'll resume at 11:20.
it would be just like they were sitting here waiting for you to come back. So
Yes.
otherwise, if I shut
I
it
just
down, then they
wanted to
gotta log back on and have separate
Thank you.
feeds. So.
Those that are watching online and on the phone, we're taking a 5-minute break. Thank you. Recess. Thank you.
I want to be able to answer any questions about the
Okay.
and then I just have one consent. Thank you, both. Because that was a question that I had posed to our team as well, and I'm waiting to hear back from the state because although Christy has already provided the guidance that businesses need, so kind of like any business reaction is based on is that
Like I've never been
Here.
Yeah, I'm essentially so far. I can sell.
Things going caught on.
But nobody's ever, there hasn't been a
It was about
Okay.
30 or 40 people watching. Now they're down to about 15.
The other thing
That was
too
a lot of people
is
watching.
do you want all the businesses to register because we just have a business registration. And this is the way to do
They forgot all about these, we were.
No.
Well, it is what it's going to be.
At this point, no.
Oh, are they?
There's no.
And again, I mean, if it's
It's about 10 to 15 minutes sitting there. As usual, you just miss it.
So you can go from Jackass and come back out. So the other way
Well,
around.
I think that's the four-wheel car.
That's my favorite.
I'm good. So far.
I love it.
Lighter toe change.
We're in for a bumpy ride. We really are. It's either take a pill every day, so you don't get COVID,
I don't want to be on waterboard.
or get a vaccine.
This last couple days I got all these questions, waterboard questions. No, we have plenty, thank you, we don't need that.
It's not like we have.
Yeah, I mean, that's a special district. What are you done with the state?
State waterboard.
I don't think about it.
Cannabis licensing, yeah. I think all these questions, like, I just got an email, I tried to renew my application and I entered wrong information, can you reset it for me? No, not my form, not my site.
Oh, I'm sorry.
You know.
Well,
We down for tomorrow at 2 or Thursday at 2?
I think Thursday is what I said.
Thursday was
one
better.
will probably
Yeah,
be
tomorrow
better.
will be easy.
I saw there was an invite, but I didn't see
And
that.
I'm gonna attempt to work from home on Friday. Probably won't happen, but it was a nice thought.
Yeah.
Yeah.
Got stuck in that highway
Oh, gosh,
this
me
morning.
too. And then I took, Lisa was here with me, so I, as a general plan, I gave the feedback on our RFP. Like, we're wasting back to office, and then I hit it again, so I've been in it. To work, come here, going back, and back. Yeah, they're going real quick, real quick. So they'll be past, yeah. And then they'll be up.
So then they'll be doing, the left turn lane on Bell, so that messes up too.
That one too, shoot. Yeah, then it just go farther up the road towards my place.
Yeah, you're gonna be stuck with it for a while.
Yeah, quite a bit. Because the sign, the construction sign is right past the second. So
Believe it or not.
they're sneaking
Still
around.
with that deal, right, so they probably hear it. So.
It was lovely.
George was rabid about 10 damage to the United States. He had said it all over.
He had a nice piece of cake.
Yeah, he did have a nice piece. That was very nice. And it, you know, the other presidents just kind of shut it down with the money.
That's what you're seeing.
But you think it was kind of a klutz,
Board ready?
I see.
We're ready, thank you.
Okay, thank you.
but I'm looking
Yep.
for Nixon.
Thank you.
Several.
11:25, we're back in session, and we're starting with our proclamation. It's item 1.1, a proclamation 2020 Older Americans Month. And we're not reading the proclamation?
No, we don't need to. You can take public comment on it. I
Yeah.
appreciate that. I can read it real quick if you really want to. And then, once public comment, I'll make a motion.
Let me ask the public, please mute your phone, especially whoever's moving furniture.
Stop sneezing on your phone.
So we'll take public comment on item 1.1. Having heard none,
Motion to approve proclamation of the Board of Supervisors recognizing May 2020.
second.
Thank you.
Were you reading? Sorry.
We're gonna have to turn them down when we're not.
You all know I make faces at you here.
I can't see you.
Supervisor Morris?
Yes.
Supervisor Finley?
Yes.
Supervisor Groves?
Aye.
Supervisor Chapman?
Aye. Thank you. Item 1.2, adopt a proclamation recognizing the week of May 3rd through the 11th, 2020 as National Correctional Officers Week. No fiscal impact. Any public comment on item 1.2? Hearing none, bring it back to the board.
Glad we're doing this. So moved.
Second.
Supervisor Finley?
Yes.
Supervisor Morris?
Yes.
Supervisor Groves?
Aye.
Supervisor Chao?
Aye. Okay, another 1.3, adopt a proclamation recognizing May 15th, 2020 as Peace Officers Memorial Day and May 10th through 16th as 2020 as Police Week. No fiscal impact. Any public comment? Bringing it back to the board.
I just want to make a quick comment, both on the last one and for peace officers. We talk a lot about healthcare workers on the line for COVID. These two sectors certainly are interacting with the public and are at risk too, so I want to thank them, both sectors, for their service.
Awesome. Good. Good job.
And I will move to approve.
Second.
Supervisor Finley? Supervisor Morris?
Yes.
Supervisor Groves?
Aye.
Supervisor Chao?
Aye. And that concludes our ones. Now we're moving on to consent calendar. These items include routine, non-controversial matters and will be acted upon by the board by one roll call motion. A member of the board, staff, public may request an item be pulled and considered separately. Board? Anyone? Staff? Anyone online or in the audience want to pull?
Yes, I would like to pull 2.1, the first one, please.
2.1. Okay, and who was that? Can't hear.
Diane Richards, I'm sorry, I keep trying to mute myself.
That's fine. Okay, so I'll open it up for any other public wanting to pull any item. I don't hear anyone, so bringing it back to the board.
I move to accept the consent agenda.
Second?
Supervisor Morris?
Yes.
Supervisor Groves?
Aye.
Supervisor Finley?
Aye.
Supervisor Chao?
Aye. So moving back to item 2.1, Mrs. Richard?
Yes, would you like to comment?
Yes, please.
That was right.
Yes.
Thank you very much for the opportunity. And I want to commend the board for getting this on the agenda and doing this. I know that Tuolumne had their recorder's office was basically just putting exempt and not taking the monies in the first place. It's been a year of this. That particular bill for housing was to get the fees from recorded documents regarding houses, etc., real estate type recordings, and it should not have fallen on our small claims minors. It was a big, basically a tragedy, because I think many of them couldn't even afford that. It made it almost $100 to renew instead of $15 every year for each claim. So I commend you for doing this and getting on board. Thank you very much for all the small miners in the mining district from Hayfork. Thank you.
Thank you, Mrs. Richards. Is there any other further comment? Bringing it back to the board.
I'll move to accept 2.1 as written.
I'll second, and thank you, Chair Chadwick, for also following up on this, because this came earlier while I was chair. We wanted it to move forward, so thank you.
Yes, it was a collaborative, and I will say that Mr. Rankin, it was his persistence. So if he's out there, thank you.
I'm sorry, may I make a comment on this? I was having some technical difficulties and couldn't weigh in.
Is this Mr. Rankin?
Yes, it is.
Yes, please. We were just appreciating your tenacity. Go ahead.
Yeah, so I just want to thank you for any support you can give me. It's been a long grassroots effort to try to correct, I believe, which is an injustice in the Senate Bill 2. And any support from organizations such as yourselves, the Board of Supervisors of various counties, will be helpful if I am able to get any movement to correct this. And I do thank you very much for any support you can provide.
Thank you. And we have a motion and a second on the floor, so we're going to pull it.
Supervisor Morris?
Yes.
Supervisor Groves?
Aye.
Supervisor Finley?
Aye.
Supervisor Chapman?
Aye. Thank you. Okay. I think now since we're doing the hokey pokey with the agenda, we're going to go to 4.1, reports and announcements. So do we have any department heads? We're going to ask the ones on the line to please, if you're on the line, can you state your name so we can write you down and put you in some kind of order?
Rick.
Okay, Rick. So far, you're the only one online. Anyone else online?
Margaret's online, but I don't have a report.
Thank you, Margaret. Okay, so.
Nelson is online, but I have no.
Okay, thank you, Shelley. So, and we have department heads in the audience. I don't know if any of them are going to speak or not. So, Rick, did you want to speak?
Rick Tippett, Director of Transportation. I just wanted to let everybody know that the roof is going up on the jail this week, and we're about to achieve our second milestone, which is the structure. And from that point on, they'll be pulling all the wires in and taking care of the inside of the building. We do have a slight delay in construction because of some of the winter delays, and then there's been some of the inefficiencies due to the COVID situation. So the opening is going to be put back a month, about 5 weeks, and we're now looking at the first week of February for the turnover to the sheriff for outfitting. So just wanted to let you guys know where we're at and why the crane is there. That's all I have to say.
Supervisors, do you have any comments? Supervisor Morris has a question.
So Rick, I'm hoping you can hear me. So I think anticipating opening date would have been this coming December, and now if I heard you correctly, we're looking at February?
Yeah, we're still going to be having a very soft dedication opening before the end of the year, but there's going to be some internal tune-ups, for better words, that have to go on before we can turn it completely over to the sheriff. That's just to make sure that we have everything up and operating at 100% when we do turn it over.
Okay, thank you for your clarification.
Supervisor Groves? No. Thank you, Rick. Margaret and Shelley both have anything, so anybody present? Director Hunter, you want to come on up? Thank you, Supervisor Groves. Appreciate that.
Good morning, Kim Hunter, Building and Planning Director. I wanted to report this morning, and I'm pleased to report that we do have a general plan request for proposals, an RFP drafted, and it's been sent out to a few folks for review internally. It has not hit the streets yet. This is anticipating at least a 3-year process with a budget of $1.5 million, mostly from the General Plan Update Fund, supplemented by some state grants, including SB2, the local Early Action Planning Grant known as LEAP, and the Regional Early Action Planning Grant known as REAP. Hard to keep those straight. So, but mainly, yeah, the majority of funds will be coming from the General Plan Fund set aside, which has been paid with projects, building permit fees, development fees, and definitely cannabis licenses pay a large amount into this fund. So the RFP, the schedule is to get this out hopefully by the end of the week, early next week, and with a deadline for proposals by 5 p.m. May 27th. So a pretty quick turnaround. It's ambitious. It is flexible, but are looking for just comments and any suggestions you have as we
They're working on the roof as we speak. I apologize.
Big boom.
Yeah. We don't have enough to do.
Maybe that was a sign. Come down to my report.
It's now freezing over.
Yeah, pretty much so, right? It was gross. So, like I said, this was sent out for some comments before it hits the street, including to each of the 5 supervisors. So if you have any comments or suggestions.
Judy, what are they talking about? You know? What are they talking about?
We're talking about the request for proposals for the update of the general plan with the environmental impact report and a zoning update as well is the proposal.
We are on item 4.1 and Director Hunter is reporting out. If you could please mute your phone. Okay, so supervisors, do you, Supervisor Morris?
I don't have a question on this, but I have another question, but I'll wait.
Supervisor Groves?
So you're available sometime today after I'm
Yeah, yes.
No, nothing.
And I'm
Looks
good.
good. No, glad you know what you're doing.
I got a text from Supervisor Brown that he's got a couple things he wants to talk about, so he'll contact you directly.
Right.
Thank you. And
as well.
was there somebody on the public that, besides? Okay, I don't hear anybody.
Okay, I'm a member of the public calling in. I would like to have 2.2 pulled and voted on separately. I think it's controversial. My name is Jack Norland. We submitted a written comment. Hopefully we'll have it.
Actually, I got your letter last night and it was item 1.2, I believe, not item 2.2.
No, 2.2 is the proclamation of the extension of the health emergency. And our position is there is no health emergencies. There's not been one case in Trinity County. So the health department cannot, you can't have an emergency when there is no emergency. It is controversial. It's disputed.
Okay, sir, we have already voted on the consent calendar.
Oh, that's just wonderful. So you've extended a healthcare emergency where there is none? And you didn't even debate it? You just taken the money instead of representing the people of the county? It's terrible.
Public comment for this item has closed.
Well, you see, you should have an open meeting. You let the people in there from the departments come in. If I had been in there, I would have been able to speak. I can't. It's very hard to understand what's going on from the outside.
Well, sir, I appreciate your comment, but the consent item should have gone off at 9. The only reason why it was delayed whatsoever was the fact that we took a...
Well, I've been available all day, but I submitted my written comment thinking that there'd be some consideration of it.
I read your comment and we had the vote, and I appreciate your input, but a public comment on that item is closed and the vote has already happened.
I for one, words have meaning. An emergency means something that's urgent. There's nothing urgent.
Sir, if you continue to talk, we're going to have to turn the phone off to everyone. It is no longer public comment. We appreciate
it's a disgrace. It's a disgrace. It's a disgrace.
Apologize for that. So I believe that Supervisor Morris had a different question regarding something else that you haven't reported on. If you want to give her the subject matter?
Yes. Sorry.
It's all right.
Just a quick update when we might see the EIR gap.
That is going to come back for a contract amendment on the 19th, I believe. But we are working, work is continuing. Ascent is under contract, so we're making some progress. Just got feedback from a survey we sent out to the growers to get local data. And just got the results put together in a package to review. So work is continuing, but then again, you will see an item on the 19th for a contract.
But when do you see the actual document come back to us, or actually planning first?
Yeah, I'll have an answer for you on the 19th, yeah, or sooner, but a better answer, a more concrete answer on the 19th. I was supposed to go to this meeting, it didn't quite meet the deadline for the staff report, so.
Okay, yeah.
I'll get back to you on that.
Supervisor Groves? No? Thank you.
Okay, thank you.
Be safe and healthy. So, Interim Director, Ms. Hamilton, would you have anything to report out? You're all reported out. Okay. Is there anybody that I've missed on the phone that came on late? Okay. Report from County Administrative Officer Dr. Richard Coons.
I think I reported up to Supervisor Brown. Actually, also said if he has service, he's got stuff to report on during the supervisor's report.
Okay, can he hear us?
I think I have to call him.
Okay, so let him know. Yes.
For CAO.
I'm here.
Oh,
He's here.
okay, Jeremy, can we take Jeremy real quick?
Oh, okay.
All right. So, reporting out on the 30th, we had a phone call about the CRP program. It seems to be beneficial. We talked about special.
Jeremy, can you, excuse me, Jeremy, can we call you on Dr. Coons' phone and not on the speakerphone because we're getting too much feedback? I take that as a yes.
Is this better?
Oh, that is much better.
I took himself off speaker.
Yeah.
Go ahead, we'll try it.
All right, so on the 30th, I had a call with my chief from University, Director Hunter, and CAO Coons. It's beneficial. And the other report I have to do is about a Caltrans continued efforts on the highway to keep it safe and passable. I just keep getting a lot of concerned citizens that are set up with ongoing continued work on the highway, also hold the increase of their daily commute. There was concern of lack of COVID safety measures from all of the Caltrans staff members. I reached out to Caltrans as they had discussed all these issues and that people were following protocol on their way to work today. I didn't notice any specific protocols being followed, but nothing is posted, so I don't know what those protocols would necessarily look like. There's been increased concern over the McDonald's efforts they're doing, and lots of rocks are rolling across the road when they're letting people through. I've noticed multiple people with punctured tires on both sides of the construction. These concerns are relayed to Caltrans, and they responded with the 100 number for the claims for damaged vehicles. Other than that, the only thing I'm curious about is the accessibility from the local and local for these type of rent forgiveness. And I don't really have any avenues of pursuing those contacts, just putting it out there that landlords are listening, that people know landlords are able to be in a position to offer this kind of forgiveness for rent. I just want to advocate for that.
Thank you. That it was very difficult to hear, and I don't know how that is going to work over live streaming, but that was a lot of information, and I appreciate it. Thank you for making the effort to call in, Supervisor Brown. Appreciate it. Okay, I'm going to go backwards for a moment. Supervisor Morris had a question for you, Dr. Coons.
Yes.
I have a couple of questions, but I'll start off with one word. Zoom. We really need to get on the Zoom bandwagon. It's
By Friday.
By Friday. It's so tough for the public to hear, for us to hear. It's tough. That's all I got to say. But beyond that, I want to thank you and your staff for all you, I know you guys are behind pulling stuff together for COVID, and I also want to thank our state and federal representatives. I know they've been in discussions with our Health and Human Service staff trying to move things for them along, whether it's the federal stuff under Congressman Huffman or Senator McGuire, Assemblymember Wood, and also I want to publicly thank CSAC for them advocating very closely daily, if not multiple times, with the governor's office to help small counties move forward too. So that's all. Thank you very much.
Mimic that. We have a lot of support from our representatives, starting from the board level all the way up to the state. We had and other counties too. We did work with, contrary to popular belief, we worked with other counties. I signed a petition of 42 CAOs for counties below $500,000 to assist in some of the funding. So it's been a collaborative effort.
$500,000 or 500,000 people?
Population or less.
Thank you.
I think we'd be the only ones at 500,000 or less.
Right, yeah.
But yes, 500,000 population or less, so 42 of us signed and sent to the governor to assist with getting the federal funds to the smaller counties, because they're not coming in as promised. But yeah, we've had nothing but cooperation. I've been on the phone almost every day with the McGuire's office. They've been instrumental in working on getting us testing, so thank you for that.
Supervisor Finley?
I have no out-of-county travel, but if I understood Jeremy correct, we used to have, we either had our tort claim online so people could fill it out, or Fred Bay published it in the paper one time. I'm not quite sure.
Dr. Coons, can you follow up on that?
But
Yes.
we might want to make our tort claim.
What was it? I couldn't tell.
It's $100, what he was referring to, that I think you're referring to, is the flat tires
Right.
on the road.
Right.
So,
On our road or the state road?
it's the state road.
Well, that's not our deal.
No, I know it's not but I'm saying just make it available so people can at least
Right.
file.
Yeah, just to follow up on what he's saying, there's been a lot of rock
Right.
and multiple flat tires on both sides.
Mhm.
So, Mr. Finley, now you're the doctor.
You're the-
Supervisor Finley, it has offered a great solution, so we'll follow up on that. Woo-hoo. Okay.
And that would probably fall under Shelley.
HR Nelson.
Is it online? Okay.
Yeah, thank you. So maybe we'll send that to all the supervisors, and we can put it on our social media or whatever we do. So Supervisor Rose?
No out-of-county travel. I will just give an update, since I am a business that's filed for the SBA monies, that after 20 days, when they said it would take 3, I finally got a notification that they received it. And they'll work on it when they get to it. So I don't know one business in the county that's received any money. I will say that there are people that are receiving their $1,200 if you have direct deposits on that money is making it. So if not, I don't believe any other families have made it.
Yeah, that's my experience as well. As far as, no, I don't have business, but everything else. So. Over the Zoom, the Continuum of Care, also CAP, and the Fire Safe Council. And Dero, I saw your hand go up.
Just speaking of the mic a little bit.
Oh, sorry. So it was over Zoom. I didn't leave the county. Continuum of Care, the CAP, the 3-county continuum for Community Action Partnership, and the Fire Safe Council. And I think that's it for me. So we're gonna, pardon? Oh, I'm sorry. I thought you said no, Alex. Okay, go ahead.
I was just addressing under his item.
Yes.
But you're right, no out-of-county travel. I would just echo what Supervisor Groves has said, that meeting with and talking with a lot of calls and meetings with business folks, they too have not received their federal funding on a variety of levels that they've applied to. That is adding to the stress, the concern about keeping their doors open. I think had that money arrived, that would have given them a little more breathing room, and that hasn't. I don't know of anyone else who's arrived, whose money has arrived either today. Maybe tomorrow will be different, but as of yet, no.
So one of the things I heard on the national radio with businesses calling in, and I've talked to a few friends, was that if you have a local salon that you patronize on a regular basis, or a place you eat, to go and purchase gift certificates, because, and we start doing that, it helps them with cash now, and you get something later, unless they close, then you're in trouble. But I would encourage that. If you have someone that, you know, if you're going to get a haircut or you're going to get your nails done and you know it, go ahead and get yourself a gift
certificate, that helps our local businesses now. So, were you done?
I do have one quick question. This should have been under his report. I know we were looking, speaking of money, CDBG money, we're still waiting on that to try and help match any funds our businesses might draw down from feds or state. Humboldt Area Foundation, I do want to thank them. They raised $2 million to offer for our businesses to apply in a loan, I believe a loan and nonprofit. So there's money out there, it's just not, the bulk of money is just not hitting the ground yet, is where we need it to happen. And I don't think we have word yet, right? On
No,
CDBG?
and that's very frustrating. We've been trying to work with HCD and get the guidelines because we do have funding here locally that we could get out immediately in the form of loans, zero interest, maybe forgivable, but we don't have the guidelines from the state yet. We're just sitting on that waiting, and I've been in contact with our representatives to push them because they keep telling us next week we're going to have these guidelines out to us.
I'll follow up on that because at the COC meeting, there was about a little over $12,000 coming for COVID-19 reasons to the county, and I was told to give Dr. Coons and Susie Cochran's a heads up, which I did, but we didn't get the important paper that had to be back on by Monday. We were supposed to get it Wednesday, and I don't think we got it until Friday, and the due date was Monday. So a lot of these things, I mean, we didn't have it, and it was Dr. Coons and Susie, our grant. If we didn't have her, we would have lost out. Not anything we had done, just the fact that the way it's processed, they take forever, and then we get it, and we're told if they need to have it back or we're not qualified. So there's, for the public, that is incredible to have that kind of turnaround, and I applaud both Dr. Coons and Susie for not missing that vote, because that's over $12,000 to Trinity County.
That would be new money.
Yes.
Compared to what the money we're sitting on. Is that right?
This is specifically for COVID-19 homeless and rapid rehab, and you know, however we as a county decide, again, cap related. So you're right. You know, it's waiting on the federal government to get it to the local level, but then the local level only has a moment. So anyway, okay, I think we're wrapped up with the reports and announcements. Going on to county matters. These items include non-routine controversial matters and are listed alphabetically by department. A member of the board or staff may request an item be heard out of order. Does anyone need to hear it out of order? No? Okay, item 5.1. Adopt a resolution changing the term from grand jury members from fiscal year to calendar year pursuant to Penal Code 905.5. Coons?
Brian?
Yes.
Well, I couldn't cover that one because I thought we were going to have somebody here that was actually doing that. Sorry.
Do you want me to read the summary?
Sounds good.
Seems pretty self.
Since you volunteered, I'll let you.
Yeah. It was generated by the courts, so judges. So I have to apologize.
So I'll just read it. So Penal Code 905.5A requires grand juries to serve terms concurrent with the county's fiscal year. However, subsection B of the same code allows the Board of Supervisors to switch the term of grand juries to coincide with a calendar year. Grand juries in Trinity County currently serve terms concurrent with the county's fiscal year, but this resolution will change the terms to be based on the calendar year instead of the fiscal year. This item is coming to you at the request of the presiding judge and court executive officer with support to county administration. If this change is approved, the current grand jury will serve another 6 months, and a new grand jury will be impaneled in December of 2020 or January of 2021. The conversion of the term from fiscal year to calendar year accomplishes two things. The first being it gives the courts and the county more time to see what happens with the current COVID-19 pandemic before impaneling a new grand jury and address potential issues
with impaneling if the situation continues. The second reason is that June and July, when current impaneling happens, are very busy times for both court and county staff. Transitioning to a calendar year term would allow for impaneling to happen in December and January, which are traditionally less busy times of the year. Alternatives include financial implications, deny resolution. Department recommendation, denial of this resolution will result in the term of the grand jury remaining unchanged. This could cause issues for the courts in impaneling the grand jury for fiscal year 2021 due to the current COVID-19 pandemic. It is staff's recommendation that the board adopt a resolution changing the term for grand jury members from fiscal year to calendar year pursuant to Penal Code 905.5. Are there any?
And we did,
Go ahead.
They gave us three alternatives, and I think it was the second alternative, which was to change it to the calendar year. And the only reservation we had was it crosses over fiscal years, but working with the auditor's office and Susie, they didn't think that would be that big of issue, and the courts were the ones that really preferred this option.
Great. Any public comment?
I move to approve.
Second.
Supervisor Finley?
Aye.
Supervisor Morris?
Yes.
Supervisor Groves?
Aye.
Supervisor Chapman?
Aye.
Supervisor Brown, are you on it?
Thank you for remembering that. Okay, item 5.2, pursuant to the county fee waiver policy, find the Trinity Center Volunteer Fire Department apparatus building project provides a benefit to the public and is not for the purpose of fundraising, and approve the Trinity Center Volunteer Fire Department's application for waiver of the county fees, waiving planning fees in the amount of $2,145 and transportation fees in the amount of $150. Potential loss of revenue to the planning department in the amount of $2,145 and transportation fees in the amount of $150. I do believe there has been a revision to this.
Yeah.
So before we talk about it, could you present the revision?
Kim Hunter, Building and Planning Director. On this item, there was an anticipated amendment to the use permit that would be needed, and that's what the fee reflects from the planning.
Step back just a tiny little bit. Your mic is, thank you, perfect.
Usually,
Yeah.
people don't hear me. Sorry about that. So yes, the fee, so upon further review of that anticipated date of a use permit amendment, realized that the conditions of approval and the existing use permit covered what was needed with the additional structure on a vacant parcel, and the conditions of approval were applicable, and other than a note to the file and updated site plan, there was really no need to amend the use permit. Therefore, the planning fees are unnecessary.
So that's good news.
But the transportation fee still,
The $150 encroachment fee from Department of Transportation still applies, yes.
Any questions? They're clear as mud?
Transportation fees, is that for an apron, or do you know? It's not under...
Encroachment, yes. I don't know if it includes, I believe it's the encroachment permit, but maybe Rick's on the line.
yes, it's the
They still
encroachment
want to keep,
permit.
they still want to keep that as a waived fee, correct?
Yes. Yes.
Okay.
Yes, so it's 150 for total weight fee. So is there anybody on the public side? Bringing it back.
Motion, you ready?
Yes.
Motion to approve as presented with the change of it only being $150 for the transportation fee.
I'll second.
Sounds good.
I want to make sure that's clear.
Supervisor Groves?
Aye.
Supervisor Finley?
Aye.
Supervisor Morris?
Yes.
Supervisor Chapman?
Yes. You want to ask Brown if he's on the phone, just so it's on the
Supervisor
record?
Brown, are you on the phone?
So I'll read the closed session items and bring it to the public, and I believe we need to report out on the last closed session after that. Closed session,
6.1 Government Code Section 54954.5, parentheses C, conference with legal counsel, existing litigation, number of cases 1, Westlands Water District 5, all persons interested in the matter of the contract between the United States and the Westlands Water District, Fresno County Superior Court case number 19CECG03887. Item 6.2, continued from April 21st, 2020, Government Code Section 54954.5, parentheses E, public appointment, Richard Coons, County Administrative Officer. Regarding the April 20, any public comment? Having seen none, we'll report out on April 21st, closed session. Item 5.1, direction was given to staff. Item 5.2, it was moved to today, continued to today. That's it.
Close until close, you're going to close the closed session?
We're closing for closed session.
And you're going to report that next
And
meeting?
we'll do it at the beginning, hopefully, if you're here in time. Otherwise, we'll just wait to the end.
Sure.
We thank you, everybody who's on the public line. We are disconnecting. Margaret?